class is basically is just to improve your marks. The main aim of my main aim is to improve your marks. Okay, you have studied. Yes, okay, some of you have completed, some of you have done the exam, some of you are in the middle of your preparation. Okay, very few just starting as well. They also so enthusiastic that they wanted to do the masterclass. Fine, right? But the main aim here is our aim here is to improve your marks. Normally, people have a trouble with the results. Is basically they need like 1 or 2 marks. Okay, if you had a 2 marks, now would have passed in the previous attempt. Okay, the majority of you are at the borderline. Okay, my aim here is to just to push a little bit above the borderline. Okay, that is my aim here. How I am going to achieve, how we are going to achieve that. Okay, how? Because the first thing is mainly I'll focus on the management. Management. How to focus on the management is how to what is actually management? First thing, having an understanding what is actually management. Okay, and what sort of what are the objectives? When you have an understanding about the objectives means what they are looking for, what they are actually checking in you. Okay, what they are looking for. Okay, what sort of information they are looking for. Okay, from you. Okay, bringing the understanding. When you have a more understanding, okay, so when you have a more understanding about the exam and the objectives, okay, you will not have a problem with management. So focusing on all three domains, okay, that is, just pushing a little bit in terms of data gathering, in terms of interpersonal. Okay, interpersonal also we need to have a right understanding about what is really the interpersonal skills. Okay, right. So creating more awareness, bringing more understanding in all three domains. Okay. Creating all this. I mean, by making you to start thinking basically. Okay, about this. Okay, about all three domains will increase our marks. Okay, that is my aim. Okay, to improve your marks, right? By doing very simple things. Okay, having more clarity in terms of scenarios, right? Yeah. So that is the main aim. Okay, right. Second thing is here, we don't have any notes or anything like that. You have to sit down and write it down. Don't study someone else's notes. Someone else's notes is someone else's brain. Okay, writing a notes is a creation. Okay, someone's created will not sync with your brain. You have to sit down and write it down, the important points that you need. Different people need different points. Okay, so don't be lazy. You cannot do this master class, by lying down on the bed. Okay, I paid 60 pounds. Let's see, everyone is going. Okay, let's see what is he going to do. No, it will not work. It will be a waste of time of yours. Okay, you need to sit down, going back to school, classroom. Okay, get a notebook and pen. People have joined yesterday. I've told you to get a notebook and pen, but I don't know the people joined this morning and last night. You need a notebook and pen. Sit down and take notes and study. When you study your own notes, you will feel so comfortable because your brain, will see that the familiarity. Okay, study your own notes. Okay, that is the best thing. Okay, that will reduce your stress. So create your own notes. Okay, don't study someone else's notes. Okay, no need to study someone else's notes. Right, good. Right, so write notes. Okay, then the timing is going to be a bit lengthy. It is heavy. It is hard. Okay, from 9 o'clock today. Sorry about the delay today. That is because of this registration and all. So, but from tomorrow onwards, we'll start 9 o'clock. 9 o'clock, almost we'll finish around 9 o'clock. Okay, so try to commit a little bit. It will be heavy. Okay, it will be heavy for you, heavy for me, but it is useful. Okay, that is someone have told you it is useful. So focus. Okay, focus. What else? Yeah, we'll have some sort of breaks as well in between. Lunch break. We'll have a 1 hour lunch break around 2:30, 3 o'clock, and we'll have some short breaks whenever we feel tired. Okay, that's it. Okay, we will try to make the use of all the time it's available for us. Okay, good. All right, what are we going to do now? The next thing is, let's talk about some few things. Okay, the first few hours, I'm just going to talk about some basic stuff. Okay, this basic stuff, first 3 hours for me is golden hour. Okay, that if you focus and if you understood that thing, 50% of our problem is solved. Okay, because that's going to be what I'm going to talk in the first 3 hours it is something is going to be slightly different than what you may be hearing it. Okay, yeah, so focus on that. Okay, let's talk about some basic steps in the beginning. Okay, good. So what are these basic steps? What are those things? Okay, first thing, Plab 2 need 3 E's. Plab 2 is a showmanship. Showmanship means it's performance. It's the performance. You need to perform. Okay, Plab 2 is not about scenario. People think it's a scenario. Of course, it's a scenario. Scenario, that is basic. You should know the scenario. You need to know, okay, what is it about? But the final thing, what will decide whether you pass or fail is your performance. Okay, the performance, in order to perform, okay, it's a showmanship. It is basically communication. Okay, that need 3 E's basically. Okay, this if you whenever you practice with somebody, once you finish your practice, okay, check your 3 E's. What are these 3 E's? First thing, you need to have a good command of English. Plab 2 is a linguistic exam. Okay, I didn't say it. Google didn't say it. GMC says this. Okay, P for professional, L for linguistic. They have said this. Okay, even they change the name or whatever, it is going to be linguistic exam. That means you need to have a good command of English. You cannot make mistakes with English. Okay, tiny mistakes. Calling the mother he. Okay, or calling the male child she. You cannot make mistakes. Okay, simple. Everyone will make mistakes. That is for sure. But you cannot make simple, common mistakes. Okay, no. Okay, you need to show the flexibility in your language. Okay, that the thing is the English that you need. You don't need to go back to Cambridge, Oxford to learn English. No need this. That most of the people make English because of laziness of the brain or not paying attention. Okay, English. Okay, speaking English, you have to be wet. Okay, yeah, it is an active activity. Okay, so if you pay attention, 50% of your English problem will go, but you cannot speak broken English. Okay, that English has to be when you take a history, when you explain something, it has to be smooth and you need to have a use of plain language. Okay, plain, simple English, but you need to focus on English. You cannot make mistakes. Things like people don't pay attention. For example, asking the duration, how long each episode lasts for. Okay, how long each episode lasts for. Okay, so focus on questions like when you take a history about somebody from somebody, you are taking a history about the child from the mother, or you are taking the history from the daughter about the mother. Has she had? Okay, how long has she been having this condition? Okay, how long has she been experiencing these symptoms? Okay, so taking the history, about somebody, from somebody, write it down. And when you take a history focus, whether you are taking, you are doing proper history or not. I mean, whether you're okay with the language or not. Okay, yeah, referring somebody. So pay attention. Okay, if you find that you have some broken English, correct it. Okay, it is. The thing is, 50% is happening because you're not paying attention. Okay, they will not like it. Second thing, you need emotions. Second E, emotions. Okay, emotions mean there are two things in terms of emotions. One is the good part. Other one is the other part. Okay, supportive part. Good part means emotion. In terms of emotions means you need to be friendly. You need to be nice. Okay, you need to be positive. Positive in terms of what you have been doing. The friendliness, the rapport. That is one side, the good side, the positive part of the emotions. Okay, rapport. When you look at the test cells, one of them is rapport. Okay, I mean, when you look at the test result, you will get 10, okay, qualitative assessment. Okay, yeah. So one of them is rapport. You need to have very good rapport. That means the patient should feel that, my doctor is friendly and nice and welcoming and positive. That is one thing. The friendliness, some people don't have a rapport. Rapport is an effort. Okay, it is an effort. Okay, it is something related to emotions. You need to be a friendly person. Okay, the vibe. Okay, sometimes when you meet some people, the vibe is good because the rapport is good. Okay, so your tone, your body language. So that is emotions. One is related to emotions. Emotions has to be there. The other one is the other part of the emotion, negative side of the emotion. Okay, rather than saying negative side, the other aspects. The other aspects means basically the empathy. People say sorry, but they don't really feel it. When you say sorry, it should come from your bottom of your heart. They should feel it. Okay, I'm really sorry about it. Some people, I'm so sorry. Some people just throw a sorry. Now, okay, the thing is, everyone is going to say sorry in certain situation. Every 16 of you. So where are you going to make the difference? Where are you going to make the difference? The way you say sorry. Okay, yeah. So okay, empathy has to be there. Okay, empathy in your tone. Empathy is a variety of things: your tone, your body language, your eyes, your facial expression, the poses. Okay, yeah, poses. You say something quite sensitive and you pause. Okay, this is all natural human behavior. But basically, Plab to need a character. Your character is good. Okay, what character? The doctor character. They need to see doctor qualities in you, basically. Okay, this thing they have to check you because in the UK, when they take people for medicine, in the first year, in the interview, they will find it out whether you naturally possess this or not. But for you, you are coming from abroad, they need to check in the exam. Okay, yeah. So you need to deliver that aura. Okay, the doctor aura. That comes with the emotions, the empathy. Okay, the way you're sorry. They say, okay, the same thing with the rapport as well. Okay, that is related to emotions. Second thing, you need energy. Okay, energy. You cannot be okay. I mean, you cannot be dead. You need to have energy. You need to have a passion, the willingness to help. Okay, you need to have the force. Okay, yeah. Some people have just aggressive and high energy. Some people is just low. No, you need to have some sort of energy that's going up and down. The energy, you know that when you talk to somebody, the energy is good. Like energy means the vibration. Okay, yeah. You need to know that. Okay, when you enter into the room, okay, it is your consultation room, and you are the boss. Okay, you need to act like a boss, but what sort of boss? Nice boss. Okay, so that energy, the overall performance should have a right energy. Energy means the flow, okay, the right tone, the tone is going up and down, the general performance that basically you have to entertain. I told you it is showmanship. You need to entertain. Okay, once you finish, the move to the next station, they need to enjoy. Oh, it was a good one. Okay, yeah. So yeah, that kind of vibe. You need to leave the room. You need to have energy. Okay, you need to be aggressively nice. That energy, the way you ask question, they explain, you acknowledge something. Okay, you show the empathy, checking understanding. Everything has to have energy. Okay, they need to see the passion when you do stuff. Okay, that you are interested in the matter. You understand? That is about the energy. Okay, so every time after finishing a scenario, you double check whether okay, how is my English? Am I making okay, is it clear? Is there any clarity in my explanation? Okay, is there any okay, logical order in there? How is my emotions? How is my energy levels? Okay, have a 3 boxes and make sure that you tick this one. You can discuss with your partner. Okay, what do you say about this? Okay, are they, you can tick them or you can cross them. All right. The next thing is initial approach. Okay, the beginning. Okay, learn how to do this. Okay, most of you are not paying attention. The first 1 minute, it is crucial for you. Okay, because basically they're going to judge you. Okay, it is not the right word, but I would say like this. Okay, what they are going to judge you? Where are you coming from? No, not really. Okay, who you are? No. Okay, basically, what sort of doctors is in you? Okay, what sort of doctor are you? So that is basically Plab 2 need critical thinking. It is all about critical thinking. Okay, you need to have a critical thinking in the communication. You need to have a critical thinking. That means when you ask question, okay, when you have critical thinking, when you solve the problem, you need critical thinking. It's all about critical thinking and decision making. So you need to think critically and make decisions. Okay, it is all about that. When you ask, that is also critical thinking. When you ask questions, because you need to ask the relevant logical questions. Okay, the same thing. Okay, the decision making, the management, also you need critical thinking and you need to have a logic. Do you understand? Yes. But apart from that, okay, so I mean, when you, in terms of doing everything, okay, you need to have a right start. The start will show you your orientation to the task. Okay, and also you need to start in a professional way. So when you start the scenario, okay, always start with hello. Never call the patient hi. Hi is casual. Okay, you cannot call the patient hi. Patient is not your friend or neighbor or somebody, because you are meeting. Patient is your patient, your client, right? So you need to call them hello. Okay, learn how to introduce yourself. People are not focusing it. They think it is not important. Okay, no, I'm wasting my time. Okay, I need to do the stuff. Some people don't believe it. Okay, now first 1 minute, 2 minutes, they will decide, okay, how this is going to go. Okay, the first impression is lasting impression. Okay, so you have a very good professional and logical start. Always you start with hello. Don't call the patient hi. Okay, don't call the patient, you must be John. Okay, some people say, hi, you must be John. John is not your neighbor, okay, newly moved to the flat. Okay, no. John, okay, John has got a full name and you are meeting, okay, John in a professional context, you need to have a full name. Okay, so we don't need this, I'm speaking to Sarah. No. Okay, you need to call the patient with a full name. So how are we going to do this? Hello? When you say hello, patient will say hello. Hello? Somebody, you have to wait for them to say hello as well. Hello. Right? Yeah. Then, hello. Then you need to introduce yourself. Okay? When you introduce, I am. Okay, I am. And doctor and your last name. Hello? Patient say hello. So you need to tell hello, I am doctor. Your last name. Okay, last name, I'm Dr. Islam. Okay, I'm Dr. Farooq. Your last name, not the first name. Okay, especially ladies. There is no Dr. Fatima. Okay, there's no Dr. Nusrat. Okay, there is no like that. This is wrong, guys. Okay, I have started changing this for a long time. My students have started changing. Now you also, my students, you have to change. Competition is high. Okay, yeah, it is wrong to actually, especially ladies, to call your first name with the doctor title. The doctor title is actually for last name. When you go to the exam, if you are a lady and you just say, okay, I'm Dr. Ahmed, the examiners know that you know the staff. Okay, you have been trained very well. Okay, they don't have a problem you knowing the scenarios, or you're doing the stuff like everyone else. No, the thing is whether you have been trained properly or not. That is their worry. Okay, that is their worries. Okay, good. So what we need to do here? Okay, the starting. Hello. I am Dr. Ahmed. Then I am one of the doctors. This last S, it is a simple grammatical mistake. People are making these mistakes. Around 1/3 of the doctors make these mistakes. I've been experiencing this, for a long time. It is a simple grammatical mistake. But when you make this tiny mistake, you think how this is going to affect me. No, the thing is they will assume that you have already one cockroach. The family is going to come. Okay, so that means you have already one mistake. I can anticipate there are going to be a lot of mistakes in the communication. We don't want to give this impression in the beginning. Okay, correct and pay focus and attention, pay attention to this. Okay, you see in the master class how much we are rushed, okay, how much we have very little time, but still I took some time to talk about this thing, okay, because it is important. It matters. Okay, right. Because the competition is high now. Okay, so make this, okay, don't make these mistakes. I am one of the doctors. Okay, so it is always, okay, hello, I'm Dr. Ahmed. I'm one of the doctors in this department or in this GP practice. GP practice, you can say GP practice in the surgery, okay, in this clinic. Also, that is fine. Okay, yeah. So I'm one of the doctors in this practice. I'm one of the doctors in this in this GP clinic or in this surgery, right? That is, I'm one of the doctors. Okay, the only thing I need to tell you about this S, right? GP is not a department. Okay, so in the GP, don't say that I'm one of the doctors in this department. Okay, then you need to ask the patient, are you? Okay, are you and the patient's first name? Our patient's full name. Are you John Parker? Okay, are you Rebecca Jones? Hello. I'm Dr. Levan. I'm one of the doctors. Okay, are you John Parker? I am and are you? I am and are you? I am and are you? Can you memorize like this? I am and are you? Okay, are you John Parker? Are you Patricia Jones? Okay, are you Rebecca Jones? Okay, are you Emma Taylor? Okay, it's better to know the name. It is better to know the name. Know the name of the patient. Okay, yeah, know the name of the patient if the name is there. Because you know this, you are waiting for next patient and you have been reading patient notes. You know that your next patient is Emma Taylor. Oh, hello, I'm Dr. Levan, one of the doctors. Okay, I'm one of the doctors in this practice. Are you Emma Taylor? I am and are you? I am and are you? I am and are you? Okay, make sure that you fix this one. Okay, we don't need this one. You cannot call, okay, hello, are you Sarah? You don't do like this. Okay, Sarah, can you confirm your name and age, please? Okay, some people come in like this. Hello? Okay, I'm Dr. Levan, one of the doctors. Can you confirm your name and age, please? Don't do this. Okay, can you confirm your name and age, please? You see, I took some time to invest in this because there is a reason for this. Okay, you need to change. Okay, we are not recruiting for army. Name and age, please. Name and age, please. Name and age, please. No. This is not good for rapport. Okay, which one? Can you confirm your name and age, please? Can you confirm your name and age, please? Okay, don't do this. Everyone is doing it. Let them do it. Okay, you don't do it. Okay, start nicely. Okay, start nicely. So hello. Okay, I'm Dr. Levan, one of the doctors, and it has to be on your last name. Okay, it has to be on your last name. Okay, right. So that is, I'm doctor, your last name, are you Sandra Jones? Then when it comes to ladies, you need to be very careful in terms of Miss and Mrs. If the scenario says patient is Mrs. Rebecca Jones, it's fine. If the scenario doesn't say it, if you call them with the wrong title, okay, everything I say in this masterclass is someone's story. Okay, if you call somebody with the wrong title, what can happen? Patient can disturb you. Okay, in the beginning. Okay, so if the patient story doesn't say Mrs. Rebecca Jones, okay, patient will tell you, doctor, I'm not Mrs. Rebecca Jones. Okay, I'm just Rebecca Jones. Then you will think, oh my God, I made a mistake. This will deviate your focus. I made a mistake. I don't know I'm going to pass or fail this station. not only that is going to affect this station, it is going to affect the following station as well. Okay, you shouldn't be in this situation. Okay, you shouldn't be in this situation. Okay, now read carefully, especially for ladies. The scenario says Mrs. Rebecca Jones is no, it's not a problem. I am Mrs. Rebecca Jones. Okay, or okay, it says it's Miss Rebecca Jones. I am Miss Rebecca Jones. If there is no to there, it's fine. If you are not sure, just ask, are you Rebecca Jones? Okay, some people call like, are you Mrs. Rebecca? There is no Mrs. Rebecca. Ask, there is no Mrs. Okay, Dr. Fatima. There is no Dr. Fatima. Okay, do you know what I mean? Okay, you understand what I mean by? Okay, same thing. Okay, there's no Mrs. Rebecca. Either she can be Mrs. Rebecca Jones. This is basic. Okay, but I don't want you to make these mistakes. It's okay, yeah, because you have been not paying attention. In the exam context, it's competitive. It's very competitive. Okay, so they are looking for who is weak here. I don't want you to be weak from today. Okay, right. So, okay, so Mrs. Rebecca Jones. Okay, oh, if that is okay. Or Mrs. Jones. Mrs. Jones is polite and nice, and that is good. Mrs. Jones. I am Mrs. Jones. Okay, how did you know? It's written. Okay, Mrs. Rebecca Jones. What? Okay, yeah. So that is this part. Okay, so yes. So okay, let's do the introduction again. Hello, hello. Okay, I am Dr. Luban. I'm one of the doctors. Are you Rebecca Jones? Yes. So name and age you need to ask one by one. Now you ask the patient, can you please confirm your age for me? Okay, so are you Rebecca Jones? Yes. Yes, Rebecca Jones. So Rebecca Jones, can you please confirm your age for me? It is a separate question. Okay, right. Then, now you want to call her Rebecca, right? So you need to, for that, you can ask either, what can I call you? What, not how, what can I call you? Or you can ask, what would you like me to call you? But it is what. Okay, what can I call you? Not how. Okay, what can I call you? What? Or you can even ask if you want, can I call you Rebecca? Can I call you Rebecca? Okay, now you tell the, okay, Rebecca, that nice to meet you, Rebecca. Or nice to meet you, Mrs. Jones. Sometimes patient will tell you, doctor, call me Mrs. Jones. Okay, nice to meet you. Nice to meet you, Mrs. Jones. Okay, did we fix the beginning? Okay, hello, hello. I am. Okay, I am and are you? Okay, my name is it is not the best one. Okay, but if you are doing it, it's fine. But I'm Dr. Levan. I'm one of the doctors. Are you Rebecca Jones? Yes. Hello, Rebecca Jones. Can you please confirm your age for me? I'm 62. Okay. So what can I call you, Rebecca Jones? Okay. Can I call you Rebecca? Yes. You call me Rebecca. Now you need to tell, nice to meet you. Okay. I'm pleased to meet you. Okay. Or nice to meet you. Okay. Nice to meet you, Rebecca. Or nice, I'm pleased to meet you. Okay. Mrs. Jones. Okay. That is okay in the beginning. Okay. Don't make any mistakes. Okay. Today onwards, don't do this. You must be John. John is not your neighbor. Okay. Sometimes some people have a John Parker. Some people keep on calling Mr. John. John Parker is not Mr. John. Okay, you cannot call him, okay, Mr. John. John Parker can be a Mr. Parker, or he can be, okay, Mr. John Parker. Or you have to call him just John. But in order to call somebody with their first name, you need to get their permission. Okay, I'm not going to talk about this anymore. Fix this one. Okay, don't make it impress. Impress from in the Plab 2, you need to impress the examiner. How to impress? Okay, how to impress with the right start. Okay, the logical approach, with the critical thinking. Okay, yeah, with the right organization, good communication. Okay, yeah, impress. Okay, these things will not impress them. Okay, if you do things like this. Okay, you must be John. I told you, John is not your neighbor. Okay, yeah. Right, so don't make any mistakes on this. Guys, okay, if you have any questions, I take questions after the class late in the evening. We don't interact. We have so much things to do. But if you have any questions, leave in the WhatsApp group, or you can ask me after the class in the evening, but not in the middle, right? But if you have a question, it's better to be answered. Write it down. Okay, you have a page for questions somewhere. Write it down. Sometimes if you wait patiently, the answers will come in the class. Okay, the next one is telephone approach. We have one telephone and video. Okay, so I mean, in the past, it used to be 5 telephones, right? Yeah, I mean, 6 scenarios, 2 video, 4 telephone in the street. Now they have changed it 1 video and 1 telephone consistently, right? Even at the video station, outside it will be written telephone conversation, okay? But inside when you go, there will be a TV. This has been missed by many people. Please don't make this mistake. Okay, that outside is written telephone, so your brain already will fix, okay, this is going to be a telephone conversation, okay, it's going to be a telephone, okay, telephone consultation. But when you go inside, this what I'm talking now is had happened to many, like around tens of students. Okay, yeah, because the brain already fixed it's going to be telephone, they will go and look at the telephone and do things, then they will see, oh, there is a TV. Okay, so be careful on that. Okay, yeah, a couple of days ago also happened to somebody. Okay, yeah, this time I always hear this. Be careful on this. So we have 1 telephone and one video. Okay, let's see, okay, what to do about it. Okay, first thing, telephone, the basic things, telephone is always you call. It is the doctor who calls. Okay, it can, even patient wanted to speak to you. If patient wanted to speak to you, what will happen? Patient will call the receptionist and make an appointment. Okay, then doctor, you will call. Okay, yeah, that's how. Okay, it is not like a doctor sitting like this. Okay, telephone rings, hello, who is this? No, it doesn't work like that. You have a schedule. Okay, you have a schedule. Next patient is a telephone conversation. Okay, that is one thing. So what is the understanding? Always it is the doctor who calls. Even this can be in the hospital setup. Okay, if the patient wanted to speak to a doctor, patient will call the hospital and tell the nurses. The nurses will arrange. Then the nurse will ask you to speak to the patient. It is you, doctor, always call. Okay, that is one thing. Second thing, telephone call has to be started as anonymous. Okay, even though it's okay, anonymous means, okay, if it's a telephone call, what will happen? Patient knows that, okay, my doctor is going to call me at 3 o'clock today. So what will happen? Patient will wait, okay? Patient will wait with the phone. Okay, the call is going to come. Okay, the call is going to come. Patient will wait. Okay, then you call. So it is number one is anonymous. Okay, and anonymous means that you need to ask for the patient. The second thing, it is the doctor who calls. Okay, right. In terms of telephone, I just wanted to tell you one more thing. That is, okay, maybe when I finish this one. Okay, yeah, when I finish this one, I'll talk about this. Okay, right. Okay. Right, so the telephone approach, they will have enough information on the table in order for you to use it. Okay, in order for you to use it, like the patient's name or relative name and the date of birth and the address, they study everything and start. Telephone call, okay, you study everything and start. Always you ask for the patient. Telephone call is not like, okay, ask, hello, I'm Dr. Levan, one of the doctors. It is not like that. This is why I said it's anonymous. Always when you say hello, other side say hello. Then you ask the patient, is this James Parker? Am I speaking to James Parker? Okay, you ask for the patient. You haven't introduced it yet. Okay, but in real, it is the other way around. In real, you introduce first. That is the polite way. Hello, I'm Dr. Levan, one of the doctors. But in telephone, hello, am I speaking to James Parker? Okay, the one you usually do, okay, that has to be for the telephone. Okay, you may be doing the other way around. Be careful. Okay, am I speaking to James Parker? Hello. Is this James Parker? Yes. Then if they say, yes, speaking, then you need to introduce yourself. Learn this one. There are 5 steps. Logically learn this one. They are in a logical order. Religiously learn this one. Even any scenarios related to telephone, Okay, any related to telephone, you go and apply this one. It will work. I can, okay, I guarantee this. So first one, ask for the patient. Okay, how to ask for the patient? Are you James Parker? Yes, speaking. Then you introduce. So James Parker, I'm Dr. Levan. I'm one of the doctors. I'm calling from the Manchester Hospital. You introduce yourself. Okay. Second, you introduce yourself. After introducing yourself, okay, after introducing yourself, third thing, you need to tell the reason for the call. The reason I'm calling you today, okay, the reason I'm calling you today, because you need to tell that I understand we have an appointment today. Or I understand that you wanted to speak to one of the doctors. Or I understand that your mother has been admitted with us, so I've been asked to speak to you. Okay, the reason I'm calling you. Okay, the reason I'm calling you today is, okay, it's I've been asked to discuss about your mother. To tell the purpose of the call. Okay, you need to tell the purpose of the call, then ask the patient, is it good time to talk? Well, okay, can we go ahead? Is it good time to talk? Then patient says, yes, good time to talk. Then, okay, you need to, okay, before I proceed, I just wanted to check some details because I wanted to make sure that I'm speaking to the right person. Okay, then can I check some details? Okay, then do one by one. Okay, can you please confirm your first line of your address? First line in the UK, a number and the street name. Okay, so it is 42 West Street. Okay, then can you also please confirm your date of birth for me? Okay, your date of birth for me. Okay, whatever the date of birth they have given. Two, information. Okay, can you please confirm? Okay, some people ask like this, are you still living this 45, okay, West Street? Don't do this. Okay, are you going to, okay, send some parcel, okay, delivery? Okay, I'm going to send this to this address. No, this is identity check. Okay, so ask them to confirm it. You politely tell that I would like to check some details because I wanted to make sure that I'm speaking to the very right person. Okay, therefore, can I check some details that I have in front of me? So can you please confirm your first line of your, okay, address, please? Thank you. One by one. Okay, then, okay, can you please confirm your, okay, date of birth for me? Thank you. That's it. Okay, that's it. So do it in a logical order. First, ask the patient, okay, am I speaking to Mark Jones? Yes, speaking. I'm Dr. Levan. I'm one of the doctors. I'm calling for GP practice. Patient will say, hello, doctor. Hi there, doctor. I'm waiting for this call. They will speak naturally. So I understand that we have an appointment right now. Yes. So it's a good time to talk. Okay, can we proceed? Yes, we can proceed. So, okay, so Mr. Johnson, before you proceed, I just wanted to do some formalities. I just wanted to check some details that I have in front of me. I wanted to make sure that I'm speaking naturally. Okay, I wanted to check some details in order to make sure that I'm speaking to the very right person. So can you please confirm your first line of your address for me, please? And your date of birth for me, please. Thank you very much. Then you start the talk. That's it. That is the end of it. Okay, right. Avoid this one, call drops drama. Okay, what is this? People have been doing this. Okay, if this call drops, can I call you on the same number? Okay, avoid this one, guys. You don't know what it is. You don't know what you are doing. What is this? Okay, if the call drops, can I call you on the same number? Okay, you don't need it for normal telephone communication. Actually, it is the call drops. I tell you what it is. Okay, you ask for, if the call drops, okay, do you have another number to call? Do you have another number to call? That is for where, not for simple communication. The evening, okay, you are discussing about some test results or something, not for this. This is for triage call. Triage call means in the UK, okay, we have two type of emergencies. One is the real emergency, like a heart attack or stroke or somebody having anaphylaxis. You need to call 999. Okay, then the medium to sort of emergencies, like somebody's vomiting. Okay, somebody's child is having a fever. Okay, then, okay, that is you call triage 101. Okay, some GPs, they answer these calls. Okay, yeah, in the, so those situation, it is emergency. Okay, in that emergency situation, you ask usually, if this call drops, do you have another number to call? Okay, yeah, but it's, even if you miss it, it is fine. Okay, so that is for that, not for every single scenario. If this call drops, can I call you on the same number? What is this? That is waste of the time. I don't mind wasting time. The problem is when the examiners here, they will think that you are doing it like a parrot because someone in the academy asked you to do it, but you don't understand about it. So you are just doing it. That this thing they will not like it. Because it is when you are not using your own brain, okay, they will not like it. Okay, they will not like this one. So don't do these things. Okay, we don't need this call drops drama. Okay, the finally, in terms of telephone, what they have been doing recently, that's one of the social media, the Twitter scenario, we will do it later. Okay, they are doing it over the phone now. Okay, over the phone. Twitter scenario, you're speaking to your colleague. Okay, colleague is not your patient. Is your patient? Colleague, is your colleague your patient? No. You don't need a date of birth or address. They will not give you. Okay, they will not give you because they're not your patient. You don't need identity check. Some people look for identity check. No, not needed because your colleague, you know that. Okay, it is basically simply you start hello, okay, hello, yeah. So is it John? Yes, John, I understand that you wanted to speak to me. Yeah, you just talk. Okay, just talk. Okay, so there's no identity check or anything like that. The social media, the Twitter scenario, now it has been 2-3 times is on the telephone. Okay, but there's no details as well. You don't need it. Okay, why do you need identity check when you speak to a colleague? That's okay, that's all. But religiously learn these 5 steps in telephone. Go and try. It can be breaking bad news. It can be testers of discussion. It can be somebody wanted to speak to you about something. This will work. Okay, these 5 steps. The next one is learn to acknowledge. Okay, learn to acknowledge is another thing. Sometimes acknowledging something could be the data gathering, it could be the interpersonal, it could be the management as well. Learn to acknowledge. Okay, because in the beginning they may start with the different way. Okay, when you say how may I help you? Okay, they can not like they can start in a different way. You need to show that the flexibility in your communication. Okay, patient will tell you the first one. My husband asked you to see you, doctor. Okay, my husband asked you to see you, doctor. Right? Yeah. So you need to acknowledge that properly. So my husband asked you to ask me to see you, doctor. My husband asked me to see you. So you need to ask. Can I please ask you why did your husband ask you to see us? Okay. So you need to ask. Okay, my daughter asked me to see you, doctor. So why did your daughter ask you to see us? Okay, you need to, because when they say like this, there is a purpose. Everything they do with a purpose. So that means they are checking on you. How are you going to properly acknowledge this? Okay, patient, I tell you, my daughter thinks that, my daughter asked me to see you. You can ask her, why did your daughter ask you to see us? Because she thinks that I have dementia. So you need to ask, why does she think that you have dementia? Why does she think that you have dementia? When you start, if you don't fix this, when these things doesn't go smoothly in the beginning, okay, they can assume about you. I don't want you to that happen. Okay, the communication has to be smooth. So why does she think that you have dementia? Okay, patient will tell you, doctor, I have an embarrassing problem. So you need to acknowledge that. Okay, someone come and say there are 2-3 scenarios. Patient will come and tell you, doctor, I have an embarrassing problem. So what do you say that? Okay, nothing to be embarrassed, Mrs. Johnson. Nothing to be embarrassed. Okay, as doctors, we come across various problem of our patients on a daily basis. Okay, you don't need to be embarrassed. Okay, this may be the first time we may be seeing something like this. Okay, this may not be the first time. Okay, so you need to tell first thing nothing, okay, Mr. Johnson, nothing to be embarrassed. Okay, this is okay. We always see, okay, various variety of problems of our patients on a daily basis. Okay, so you don't need to be embarrassed. This may be it may not be the first time we may hear something like this. Okay, just acknowledge that. Okay, nothing to be embarrassed. Okay, you don't need to be embarrassed. Okay, body language, next one. So, okay, the first thing is you hear them. Okay, these two, that you hear them. Okay, you hear them. First two. Okay, you hear them. Okay, the last one is you're going to see them. When you see it, you say it. When you hear it, you say it. Okay, acknowledging. This has to be part of it. This is a communication. Okay, communication tool. Okay, yeah. So body language. Body language, when you see them, you need to acknowledge it. Usually they are anxious. Okay, yeah, a little bit anxious. So when you see, you say that you see them. How are you going to say that? I can see that. When we do angry patients, okay, and some other patients, okay, some angry patients or abuse-related scenarios, okay, we need a lot on this. Okay, we will repeat this one, but let's quickly do this. Okay, somebody is in front of you, fidgeting their hands, okay, moving their hands and looking down. Okay, yeah, okay, they're rubbing the feet on the floor or something like that. When you see things like this, you need to tell. But the thing is, you don't say directly. You need to learn this one. Okay, if someone is not making eye contacts, you don't tell them that you are not making eye contacts. You are not making eye contacts. You can make eye contacts with me. You shouldn't say like this. That is rude. That is not polite. If someone is making eye contacts and looking down, you need to tell in a different way, indirectly. How to say that? It seems like something is bothering you. Okay, Mr. Johnson, it seems like something is bothering you. Is there anything bothering you? Okay, is there anything disturbing you? Is there anything you would like to talk? Okay, yeah, but okay, this is very important. You need to pay attention. People don't hear this one. And okay, you don't tell the patient. If the patient is fidgeting their hands, you don't tell them, I can see that you're fidgeting your hands. No, it's why somebody is fidgeting their hands. That means they're anxious. What is the outcome of this? What is the analysis of this one? Okay, so it seems like you are a little bit nervous. It seems like you're a little bit anxious. It seems like something is bothering you. Is there anything bothering you? Are you anxious about anything? Okay, yeah. So, but you need to acknowledge. Okay, but if somebody is not doing, don't over acknowledge. Some people just robotic. Somebody sitting, okay, I can see that you are a little bit nervous. No, I'm okay. So that you need to have an emotional intelligence, whether it is something need to be commented or not. You need to see the same thing for the pain as well. Okay, we'll talk about pain later. That is going, otherwise it's going to take so much time. But okay, so body language, when you see it, you say it. Okay, I can see that. Okay, it's something. It seems like something is bothering you. Okay, is there anything you would like to talk? No, a patient say, no, okay, I'm fine. So you have tried with your first line. So, but you think that you need to get some more information. Patient is not opening up. Then you need to offer confidentiality. Okay, so how to offer confidentiality? Okay, look, Mrs. Johnson, whatever we discuss will remain confidential. When you offer confidentiality, just offer confidentiality. Okay, we don't need to tell that as long as everyone is safe. Okay, medical team, surgical team, cleaning team, we don't need this. If someone asks you, secondly, how confidential is the doctor, then you can tell. Okay, but when you offer confidentiality, offer a decent confidentiality. Whatever we discuss will remain confidential. Okay, that is about it. Okay, then, so that is about confidentiality. Confidentiality, again, okay, we will talk about it later, but the thing is, in terms of confidentiality, you need to feel that. You cannot just confidentiality is like opening a door. Okay, if the door is simply open, you just open and enter. Okay, with the door handle. The door handle is the body language. You will try first time, okay, second time, it will open and you go. But if the door is locked, you need the key. The key is the confidentiality. So you need to realize that if the door is open, if you put a key, you don't make sense because the door is open. Okay, think logically like this. But in the meantime, a door is locked. You cannot keep on trying. No, you cannot do that. You need to sense it. Okay, I've tried first and twice. No, now it needs the key. Let's put the key. The key is the confidentiality. So this one is a momental thing in the exam because different simulators will act differently. You need to have a natural skills, okay, that the intelligence that you need to, okay, understand, okay, this is the time, okay, I need to give the confidentiality now. But meantime, okay, it is very simple. It is not necessary here, okay, just I can simply ask and move on. So when the confidentiality is not necessary, giving confidentiality, it's also will have a problem. At the meantime, when it's necessary, confidentiality is necessary, you keep on trying, and wasting 4 minutes also will not make any sense. Okay, this all you need to realize it naturally. You need to use your emotional intelligence to make a decision in this. The last one is the angry patient. When somebody is angry patients will do it separately, but you need to acknowledge them. How to acknowledge when somebody is angry? You need to tell them, I can see that you are quite upset. Okay, you can tell 3 things. I can see that, Mr. Johnson, you're quite upset about this. Okay, first thing. The second thing you can tell, I can see that you're not very happy about this. I see that, Mr. Johnson, you're not very happy about this. I see. Okay, I can see. Not I understand. Okay, not I understand. No, I can see. Okay, when somebody is angry, what do you say? I can see. Okay, the last one you can tell, I can see that you're very angry about it. But the angry, you need to tell if they're really aggressive and angry. Okay, really shouting. Okay, yeah. But normally if somebody is telling and this showing their frustration, okay, you use this. Okay, but never use the word frustrated and agitated. Okay, frustrated and agitated, you will never use it in Plab 2, in the entire Plab 2. You will not need it. Okay, so a lot of things in the masterclass, I will keep on telling you, don't do this, don't do this, don't do this. You need to learn, you need to listen. Other people have listened. Okay, then they are in a better place. You need to listen. When I say things that don't do it, you don't do it. Okay, don't use the word agitated, okay, and frustrated. Okay, those are not good ones. Okay, frustrated, it's even bad. Okay, when you say frustrated, my mom is frustrated. That means I don't really acknowledge what is he doing, but she is doing something. If someone says, my girlfriend is frustrated, means, yeah, she's frustrated, but I don't really. You understand? Yeah, they are not very good for acknowledging. Frustrated and agitated. I don't need to tell an example, but if you don't fix this in your brain, okay, when you are stressed, you might use this. No, very simple ones. What do you say? I can see that you are quite upset. This is for angry patient. Okay, I can see that you are quite upset. I can see that you are not very happy. Okay, then I can see that you are quite angry about this, Mr. Johnson. Then you may have to do, so maybe it is understandable, something that we will learn, okay, further how to acknowledge. But this thing, when you hear it, you say it. When you see it, you say it. Okay, right. These things, sometimes you don't know when this will come. It can come suddenly. Okay, some of the scenarios we know how it comes, but sometimes it can be slightly different. Right. Okay, next one is, okay, starting. Okay, starting. Okay, starting with the relatives. or starting with paraphrasing or non-paraphrasing. The starting is very important. Okay, why starting is important? Because Plab 2 is basically, okay, basically, okay, I mean, in Plab 2 is about, is a scene. Okay, scene. So in that scene, right, simulator has a position, you have a position. Okay, they have a role, you have a role. You need to be very well oriented to your role. Okay, because if you are not very well oriented to your role, it is very difficult for simulator to do their role. Okay, yeah. So what will happen if you are not if you don't read the scenario properly, if you are not very well oriented, okay, then it is difficult for simulators to is to do the stuff, continue the conversation, so they can tell you some random things. Okay, the orientation is very important. Okay, when you meet a patient, the purpose has to be either it is your plan or it's patient plan. Okay, yeah, it is your plan or your patient plan. Okay, if it is your plan, you need to paraphrase. Okay, what are your plans? Okay, asking the patient to come for follow-up. Okay, follow-up maybe after the test results, or maybe follow-up after somebody has been diagnosed and on a treatment. Okay, that is your plan. Or if it is a patient plan. If it is the other side is patient plan. Okay, patient plan means patient made an appointment. Okay, why patient wanted to, maybe patient is having a symptom. Okay, some symptom. Or patient received a letter and wanted to speak to you about something. Or patient is going to go through a treatment, patient wanted to speak to you about it. Or patient may have some other concern about somebody. Okay, yeah. So if it is a patient plan, okay, that is non-paraphrasing. After finishing the initial part, you need to ask the patient, how can I help you? If it is a patient's plan. If it is a patient plan, you ask the patient, how can I help you? You need to clearly read the task. When you read, it's very important. If you have I call this, if you don't do it properly, disorientation. If you have a disorientation, they will not like it. Okay, you may lose the entire scenario if you have a disorientation. For example, if it is the patient who made the appointment to talk to you, but you did everything like you called the patient to come, that is going to cause you problem. Okay, because you have been doing everything, not realizing the actual task. Okay, you need to be very oriented to that. Okay, if the patient come to you, you need to ask the patient, how may I help you? Maybe you can paraphrase a little bit. Okay, but you need to simply ask, how may I help you today? Okay, that is non-paraphrasing. Paraphrasing means, somebody you call them for follow-up. So you need to tell the patient, I understand that you are here for the follow-up today. I understand that you have done some blood tests last week and you are here for the test results today. I understand that you have been asked to come. Or I understand that your father has been admitted with us, so I've been asked to come and speak to you. Okay, so paraphrasing means, you basically, you tell that, the purpose of the meeting. Okay, you need to read the task. Okay, one common mistake is kind of things that I'll tell you. For example, non-paraphrasing. Okay, non-paraphrasing, for example, if you take colonoscopy, sigmoidoscopy scenario, people have a misunderstanding about this. It is basically, patient had a sigmoidoscopy, now they wanted to do a colonoscopy, they sent a letter for this. In that scenario, it is the patient who took the appointment because, wanted to speak to the doctors. But if you don't really read and clearly understand, if you start this scenario like you wanted to do a colonoscopy, can we go for colonoscopy? No, that is because simulators can act according to their role because you are disoriented. Okay, then if you don't clearly because in that dialogue, okay, the simulator has a role, you have a role. If you clearly understand your role, okay, if you do properly, they will do their role properly. But you didn't understand, you have been asking random questions, you cannot get through scenarios. Okay, what is the solution to this? Read clearly why I am meeting this patient today. This is very important for me. This orientation. Why? Okay, even when you might get one or two new scenarios. Okay, it is so new. Look, I don't know what to do. No, you don't need to think like that. Read why I am meeting. Is it our plan? It is doctors or practice plan, or it is patient plan. Whether patient has been asked to come, or patient made an appointment and patient had come. Okay, this is very important for you. Okay, this will solve maybe 50% of your problem. The having the right orientation. Okay, at the meantime, okay, if you ask the patient to come, okay, then if you ask the patient, how may I help you? Some people do all the follow-up scenario, or how may I help you? Doctor, I'm here for the follow-up. Sorry, you are here for follow-up. You cannot do like this. Okay, you may not even pass the scenario not because of that. The examiners will think that you are totally disoriented. Okay, because you have been, you're going to do everything in the disoriented manner. You cannot do like this. Okay, you should not do like this. Okay, start with the right orientation. I understand you are here for follow-up. I understand you have been asked to come. I understand your mother has been admitted with us. I've been asked to talk to you. Okay, so can make sure you do this one properly. The orientation at the very beginning. This is all robotic, like the introduction. Nice to meet you. I understand that you wanted to speak to one of the doctors. How may I help you? Okay, things like that. Okay, but the start has to be there. Okay, start has to be there. The next thing is dealing with the relatives. Okay, learn this one. People have a problem with this. Okay, because you're speaking to the son or daughter or mother or father. Okay, right. Learn this one. The first thing, if they have given the name, that is fine. Okay, let's say you are speaking to Sas Khan. Father is Muhammad Khan. Patient is Muhammad Khan, and you are going to speak to Sas Khan. Okay, you are going to speak to the Sas Khan. If the scenario says you speak to Sas Khan, okay, you can ask the patient, hello, are you Sas Khan? After okay, hello, I'm Dr. Levan, one of the doctors. Are you Sas Khan? Yes, I am Sas Khan. What is you going to do next thing? Next thing, I understand. Okay, you don't need age or anything from Sas Khan. What you're going to say, I understand you are related to Mr. Muhammad Khan. How are you related to Mr. Muhammad Khan? Is my father. Okay. Then, is it possible for you to confirm his age for me, please? So, may I know your name, please? Or are you Sas Khan? Yes. Then I understand that you are related to Mr. Muhammad Khan. Yes. So, how are you related to Mr. Muhammad Khan? Or how are you related to him? Or what is your relationship to him? He's my father. Okay, thank you. And is it possible for you to confirm his age for me, please? Okay, right. If there is no name is given, let's say Sas Khan's name is not given, speak to the daughter, address her concerns. Hello, I'm Dr. Lawan, one of the doctors. The name is not there, no? So what will you do? May I know your name, please? Okay, may I know your name, please? Okay, why, guys, in the master class, I'm investing in the very beginning, I don't do this. Okay, now after speaking to a lot of students, I've seen people are making mistakes. In your exam day, you'll have a one or two that you may not directly speak to the patient. So you may have this one definitely on your day, but you have to fix these issues. Okay, so if there is no name in the task, what will you do? Hello. Okay, may I know your name, please? So first you need to introduce. Okay, I'm sorry. You need to introduce before ask somebody else's name. Okay, hello, hello. I'm Dr. Levan, one of the doctors. May I know your name, please? Okay, my name is Saskan. Saskan, I understand you're related to Mr. Mohammed Khan. Yes, how are you related to him? Is my father. Okay. So is it possible to confirm his age for me, please? Thank you. Now I understand, paraphrase, I understand he has been admitted with us. I've been asked to talk to you. Okay, before I explain, okay, you continue like this. Okay, yeah. So do you understand if we are when you speak to the relative, if there is a name, are you Sandra Jones? Yes. Okay, but don't ask, okay, can you tell me your full name? No, you don't need the full name of relative. Imagine you are going to hospital for your father. If they ask you what is your full name, what is that? You think that they're going to fill up some form. No, may I know your name, please? May I know your name, please? Okay, my name is Mohammed. So Mohammed, I understand you're related to, okay, Mr. Mohammed Khan. Now, how are you related to him? He's my father. Okay, is it possible to confirm your father's name and father's age as well? Okay, so how are you related to him? What is your relationship to him? Okay, like that. Okay, don't ask. Okay, the final thing I'm going to tell you how you should not do. Don't ask, are you the daughter of, okay, Patricia Jones? Okay, okay. Are you the son of, okay, William Randall? Okay, no, it is not like this. How are you related to Mr. Williams? Okay, how are you related to? I'm not going to talk about this. Okay, so fix this one. Okay, don't ask, are you the son of, okay, Mary White? No. How are you related to Mary White? Understand that you are related to, somehow related to Mary White. How are you related to Mary White? This all has to go in the beginning like a boom, 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 down, like properly practiced candidate. Okay, right, good. So that is all about starting. Then if it is a paraphrasing, or I understand you wanted to speak to one of the doctors about your mother. Okay, is there anything particularly you would like to speak to? Or if you are reaching the patient that you wanted to speak, then you need to tell that, you need to tell that, I understand your mother has been admitted with us. I've been asked to come and discuss with you about a current situation. Okay, before I explain everything, I would like to ask you some questions. Okay, that communication has to flow like this. Okay, right, good. Right, so this is all about the starting. Starting has to be very solid. You shouldn't have any confusion. You need to have very good orientation in a professional way. Once you have done, then, okay, let's look at the other stuff. The next one is about P maptosa, P1, P2 maptosa. Do I have to say anything about it? I'm not going to go through that. I'm just going to tell you some important bits that you may not be doing it. Okay. The P1 is for presenting compliant. Analyzing presenting compliant in a history scenarios is very important. People are not doing it. Okay, analyzing presenting compliant, we have a 2-3 structure. One is, okay, for simple conditions is OD para. Okay, like OD para, like that is palpitation or shortness of breath or cough or something, it is OD para. The second, for pain related, is Socrates, that you know that. Okay, Socrates, you need to learn very well. People, okay, can you imagine people have an exam in 2 weeks, but they are not doing Socrates even properly? The simulators, they know Socrates. The examiners, they know Socrates. The only person who doesn't know properly is you. The candidate who go before and goes after you, okay, they know. It is the only person who doesn't know Socrates is you. Socrates is important. Socrates will, okay, based on Socrates, there are 4 group of scenarios. We have headache, Socrates, chest pain, Socrates, back pain, Socrates, some other pains also Socrates, like ear pain, testicular pain, okay, tummy pain, everything is Socrates. Then we have too many scenarios. Okay, but your Socrates is still not ready, it's still cooking. Okay, because it's chaotic. You can't, the questions on Socrates, Okay, to go and check yourself whether are they running like a river. Proper questions. Okay, Socrates, people have Socrates or Socrates or whatever you call this. So odipara, people are not doing odipara. If I give you a dizziness scenario, okay, if I give you dizziness, for example, okay, people will not do proper odipara. Okay, yeah, you need to understand one thing. It is failure to explore the presenting complaint. Okay, failure to explore the presenting complaint is failure. In the exam, there is a structure. You have to explore the presenting complaint. Okay, you need to, the duration, it's getting better, it is getting worse, or it is, it is still the same. Is there anything makes it better, anything worse? You have to analyze people. Plab 2 is not difficult exam if you follow the structure. Okay, the problem is without analyzing this, then people try to do some other things. Okay, so first thing is, okay, make sure you analyze the problem properly. Odipara, then Socrates. There are some other, I call them non-Odipara, because the same Odipara questions will not fix. Okay, these things you need to learn. Things like weight loss. Okay, you don't ask the patient like, is there anything make it worse? No. Weight loss, weight gain, insomnia, constipation, and confusion. All these 5, okay, you have it in Plab 2. Okay, yeah, weight loss, weight gain, insomnia, constipation, and what is the last one is confusion. Confusion I might do. Okay, so all of them, it is not a simple odipara. You need to learn how to analyze all this, okay, in the presenting complaint. Okay, that is, I leave it to you, but all these 5, you need to master them. Okay, spend half an hour, then how to analyze. Someone comes and says, I have a sleeping problem. Okay, what do you mean by sleeping problem? What time you go to bed? What time you wake up? Okay, what time you wake up? How many hours do you sleep? Okay, things like that, analyzing the problem. Okay, someone comes to the weight loss, since when you are losing weight? Okay, how long this has been going on? How much weight have you lost and over the what period of time? Okay, so how did you notice your weight loss? Okay, things like that. So these things you need to learn very well. Analyzing the presenting complaint is the first key step in your data gathering. That is about presenting complaint. Okay, the presenting complaint. So this, it's for simple history scenarios. We look into this 4-color structure. Okay, that is presenting complaint. After the presenting complaint, differential. You need to have a substantial differential. Okay, some people ask how many differential we need to do. That depends on the time. But when you come to differential, first thing you need to ask about something serious. Something serious. The first thing. Something that can be, life-threatening or something serious. Okay, people talk about red flags. Red flags, I don't really consider red flags. What is red flags? Red flags are symptoms of some serious conditions. So when it comes to differential, the first thing, serious conditions need to be first thing. The second thing, common ones. Okay, then only you go for something rare. Okay, something rare. So, right? So if somebody comes with the chest pain, the serious ones like MI or PE, you check. Then the common ones like maybe gastritis or something. Then the rare ones like a costochondritis or something. You understand? But it is not about how many. That depends on the time management. Okay, yeah, that is about differential. Another thing I have found this one. Some people they don't equally distribute the questions. Some people ask for one differential, they ask 4 questions. For meningitis, 4 questions. You ask first one, second one. If that doesn't have it, move on. Okay, move on. Okay, yeah. Then some people have 4 questions for one differential, only 1 question for one differential. No, you need to ask equally 1 or 2. Okay, but yeah. But with the presenting complaint, you will find out what is the diagnosis. Okay, when you do OD para, you will find out. But still, you need to do differential. After the differential, with the differential, if you want, you can include the risk factors. Okay, the risk factors is better to be included with the D. Okay, Risk factor means, for example, somebody comes with a diarrhea. If you wanted to ask about eating out, I ask with the differential before you go to maptosa. Okay, that is better. Or maybe risk factors. Have you had a recent travel? Don't need to wait till maptosa. Okay, if somebody is asking, a lady has come with some shortness of breath. If you are thinking this is PE, if you are thinking this is PE, you can ask patient, do you take any oral contraceptive pills or have you had any recent travel? It is better to ask with the differential because that will show, reflect on your thinking. You need to reflect on your thinking. That is ideal to ask before with the differential before you ask maptosa. Okay, yeah. So the orange is basically differential and also for risk factors. Okay, the ideal one is to ask the risk factor with the differential, the direct risk factors. Okay, like serious ones, for serious ones. Okay, then the maptosa, the red one. Okay, the maptosa. In the maptosa, a couple of things I need to tell you. Okay, for me, if you ask past medical history, actually it's P maptosa. P for past medical history. When you do the analysis, if somebody asks for past medical history, that means for me, you have done with the presenting complaint and your diagnosis. Okay, basically this is step one, this is step two. So before you start past medical history, make sure you finish the differential. Once you finish the differential, then you go for maptosa. Past medical history. There are some language issues when you ask this one. First thing, when you take a history, don't use the term history. The word history, the term history is a technical term, in the medical context. If a layman, history means the usual history of Romans. Don't ask the patient, do you have any history of this? No. Don't use the word history. Do you have any past medical history? No. How to ask past medical history? Do you have any long-term medical condition? Do you have any ongoing medical problem? Okay, or have you ever been diagnosed with any long-term medical problem? Do you have any long-term medical problem? Okay, that is for, I will tell you some tiny, small things, guys. You need to learn and write it down. You need to change it. Right? So you have any long-term medical problem? Okay, that is past medical history. Medication, do you take any medication? That is fine. Don't use the word drugs. Allergy, do you have any allergies? Any food allergy? Allergy for medications. But don't ask the patient, do you react to anything? Some part of the world, they call reaction. Okay, for allergy. You know who I'm speaking to. Okay, no. So you need to ask, do you have any allergies? Not react to anything. Family, don't ask the patient, okay, do you have any family history? I told you, avoid the term history. Anyone in the family has any long-term medical problem. When it comes to family history, we are looking into two things. One, infection related. Okay, other one is genetic related in terms of family history. So if it is infection related, you ask about the symptom. You need to think. Plab 2 need lots of thinking. Plab 2 need presence of mind. Okay, you need to have the awareness about what you are talking, what you are thinking. Okay, because it's just talking exam. Okay, you need to learn to talk. At the meantime, you need to know what you are talking. Okay, there should be a very good connection between the brain and the tongue. Okay, so when it comes to family history, what I'm saying here is the symptoms. Okay, symptoms for infections. Okay, if somebody comes with a cough, you ask the patient, for example, anyone in the family had a similar cough. So infectious symptoms, fever, rash. So you ask anyone in the family had a similar diarrhea. Okay, anyone in the family had a similar discharge, like eye discharge. Okay, yeah. So you understand? So infection, you ask for symptoms. But other things like genetic, you ask for diagnosed conditions. If someone comes with the dizziness, You don't ask the patient, anyone in the family had a similar dizziness. No. Anyone in the family has been diagnosed with an ear condition. Or anyone in the family had a stroke or mini stroke. Okay, if someone comes with the chest pain, you need to ask, anyone in the family had any heart attack? If someone comes with the weakness, ask the patient, anyone in the family had a stroke or mini stroke? So family history, that has to be very clear. Very tiny things, because the listeners, your audience, you have two audience. Okay, one is the simulator, one is the examiner. They need to think that, because you're very logical. You have to be logical. Okay, you cannot be random. So when you ask like things, it matters. Anyone in the family had a similar cough, similar fever. Okay, or anyone in the family ever been diagnosed with stroke, heart attack, high cholesterol? That is about the family history. Okay, but don't use the term family history. Okay, you need to, if you have this problem, you are going to do it in every 16 scenarios. At least 4 or 5 examiners will pick it up. Okay, T for travel. Travel, have you had any recent travel? Okay, but travel is the real stress or the real risk factor. You can ask in the orange. Like somebody has got the cough and fever, you can ask, have you had any recent travel? Because that is more ideal when you ask in the orange rather than you wait for here. Okay, if someone comes with the nosebleed, you can ask, did you take any blood in the medication as a differential? You don't need to really wait for, okay, no, it has to come in the maptosa, no. Okay, yeah. So that is about the, okay, travel occupation. How to ask occupation? What do you do for living? What do you do for living? That is occupation. Okay, then as for social history. Okay, as for social history. Okay, that is social history is depend of the age, it's different thing. Okay, social history for a child is different, a 68-old is different, a middle-aged man is different. That depends on what is relevant. Okay, then I don't avoid this asking everywhere diet and exercise. Okay, someone comes with a migraine, people ask about how is your diet. Okay, avoid this one. Okay, diet and exercise is going to waste your time. It's a lot. If it's really relevant, Plab 2 is a focused history. Okay, don't. Okay, some people somebody comes with a migraine, or somebody's having tuberculosis. People ask, how is your diet? What is diet now? Okay, do you do exercise? The diet and exercise, be careful. You are so robotic. Everywhere you ask diet and exercise, you don't need it. Smoking and alcohol, they may be closely relevant. If something is closely relevant to ask, I want you to avoid this diet and exercise everywhere. Okay, because if we do like this, the examiner will think that you are just a robotic, you are not, okay, you don't have any focused thinking. Okay, the diet and exercise. You need to avoid this one. You need to, sometimes there are things that you are reluctant to leave. Okay, but you know that you have to leave. Leave it. Okay, right. A for anything else. A for anything else. That's, you know that. Okay, that's fine. But the blue one, people have a problem. Okay, what is that? Occupation and driving. Okay, and the blue one, I call them as a latter part of the history. The latter part of the history, most people have issues. Okay, mainly the last two. What are the last two? The eyes and effective symptoms. Eyes is a millennial concept. So that means it's been there for 24 years now. Okay, the eyes, there are a lot of things you need to learn about eyes. Number one, where to put the eyes. Where to put the eyes, this is the structure. Okay, where to put the eyes is the last thing just before examination. Okay, there are two wrong things that you do. Some people ask eyes with the presenting complaint. Why? The patient will tell you the diagnosis if you ask. No. Eyes, you don't ask to diagnose. You need to check the patient's idea, concerns, and expectation. Some people ask eyes after the examination. That is also wrong. Okay, no, the eyes has to come before the physical examination. Why? Okay, because if the patient says something, you need to check. Patient says the rash over here, doctor. Okay, this is an infection. Okay, in squamous cell carcinoma, the rash patient will think this is an infection. So you must have asked the eyes before, because when you check, you can see the signs of infection. Okay, if the patient thinks that this is brain tumor, okay, you must have asked the patient's idea, because when you do the physical examination, you can check for brain tumor. You understand? So one is in terms of eyes, the place. The second thing, okay, when you ask the eyes, do not address it. Okay, the second thing, like if patient says brain tumor, don't immediately say, no, 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 it is not brain tumor. But meantime, do not ignore the questions of. You need to tell, we will be discussing about it okay, shortly. I will explain to you about it. Okay, we will be discussing about it in a while. Okay, I will explain to you about it in a while. Or we will find it out in a while. Okay, you need to acknowledge it, but do not answer it. Don't answer the eyes. Do you understand? There are a lot of things. The fourth one, you must do eyes. Some people still have a problem. Do I need to do eyes? Eyes, guys, you must do. Okay, simple reason I will tell you, don't need to think about anything. When they write a script, they write for eyes. When they write a script, patient idea is this. Patient expectation is this. Okay, these are the patient's concerns. You understand? When they write the script, they write it. What they write? They write the script for eyes. Okay, that is the last reason I will tell you why you need to do eyes. Still, people have a problem. Do I need to do eyes? No, eyes taking. If people talk about patient-centered management, patient-centered management. Okay, the patient-centered management is based on, that is, patient-centered management is a little bit over-exaggerated by everybody now. Okay, but that is a different thing. Okay, that is a different thing. But the main, okay, the eyes is the root of patient-centered management. Okay, that is, if your eyes is not explored, okay, addressed properly, patient can take another appointment. Okay, so this is all about the importance of the eyes, the position of the eyes. Okay, that is the blue. That's why I created this color codes. Okay, because you need to, you cannot jump. Some people jump with some people bring the orange here. If you bring the orange here, it's going to be different color. Okay, then people finish everything, then they bring the orange. No, it has to be green. Okay, that is presenting complaint, differential, maybe risk factor, then the PMAF2, then the last bit. The last bit, there is a problem with it. Okay, this is a, if you are a first timer, you'll have so much issues with eyes. Okay, you might be keep on missing. The second time is because they learn the mistakes, they try to see what else I can do. Okay, eyes, maybe I can try eyes. You must try eyes. You must include eyes. Okay, the eyes. The last thing, how to ask about eyes. People don't really clearly ask eyes. You need to ask the patient, okay, for the idea. So, okay, what do you think? What may be causing this? Ask the patient, what is your idea? Okay, what may be thinking? Okay, I mean, what do you think? What may be causing this? Ask the patient, in your opinion, what do you think? What could be the reason for your symptoms? Okay, you learn to talk naturally. Okay, don't memorize things. Okay, if you are a memorized candidate, they can feel it. So you can push it in a borderline. No, understand the concept, learn to talk, have a structure, no one can stop you. No one can stop you. Understand the concept, have a logic, learn to talk naturally. No one can stop you. Okay, passing this exam. Okay, right. So, idea, ask in a natural way. Okay, in your opinion, what do you think? What may be causing it? Some people don't want to do ask. Why? It's wasting time. Plab 2 need quality, not the quantity. Okay, Plab 2 need, okay, quality. Okay, this one I have been telling for like 5 years. Somebody copied this one, wrote it in the Facebook. Okay, Plab 2, Plab 2 need quality. Okay, the quality of the performance, not the quantity. Quantity is important. It cannot be empty. Okay, yeah, you need to have some stuff. Okay, basic stuff, but rather you need the quality. Ice is a quality. Okay, the idea. What do you think, in your opinion, what may be causing it? Okay, that is the idea. Concern. Are you worried about anything? Are you concerned about anything? Okay, are you worried about anything? Okay, do you have any concern about anything? Okay, do you have any? Okay, are you worried about anything? Expectation. You must learn how to ask expectation. Ask, okay, like this and write it down. Is there anything particular you are hoping? Put the hope. Okay, is there anything that you are particularly hoping that we should do about this? Okay, person will tell you, okay, can I have some sleeping pills, please? Or can I have some sleeping pills? Do I need a CT scan? Okay, you need to ask all these three. Are you particularly worried about anything? Okay, is there anything particularly you are hoping? You can ask like expecting as well, but English is a technical language. Okay, if you ask nicely, it's okay. Like, is there anything particular you are expecting that we should do about this? Okay, do you have any particular expectation, Mrs. Johnson, about this? Okay. Were you having any particular expectation when you made this appointment today? Okay, yeah, don't worry about like, oh, I'm asking long sentences, going to waste your time. No. What they want is one or two things, quality ones. Okay, so first thing, they wanted to know that you naturally talk and communicate, okay, in the exam. Second thing, okay, do you have a basic medical knowledge? Third thing, are you logical? Okay, are you a critical thinker, and can you make a decision, okay, according to clinical basis and ethical basis? Okay, that's what they wanted to see. If you can demonstrate and deliver, doesn't matter, you know the scenario or not, you will pass the exam. Okay, right, good. So that is about the eyes. The next one is effect of symptoms. Okay, so effect of symptoms. You need to ask the patient how this has been affecting your life in general. Okay, that is the last one. Effect of symptom, they write a script for it. How this has been affecting, okay, your life in general. If somebody is having a long-term symptom, you need to ask about the various aspects of the life. Somebody is having a symptoms for 1 or 2 weeks, is okay. You can ask generally how this has been affecting your life in general. How this has been affecting your life in general. Right? Yeah. Okay. Yeah. But somebody is having long-term symptoms, like, a 22-year-old is having back pain for 4 months. What is that? Okay. At 28, let's say 28. A 28-year-old boy having a back pain for 4 months. What is the diagnosis? When I say things like this, you should know the diagnosis. That is ankylosing spondylitis. Okay, a young person having 4 months of back pain. Okay, a 68-year-old having back pain for 3 months. Okay, that could be prostate cancer. So or somebody is having tiredness for the last 6 months. Okay, that is chronic fatigue syndrome. So when a 50-year-old lady has come with some irritability. Okay, I get irritated. Okay, irritability, 50-year-old lady. What is the diagnosis? That is menopause or perimenopause. So if you have that sort of chronic symptoms, I have told you like 3-4 diagnoses now. Okay, you need to know things like that. Okay, you need to ask the patient, okay, how this has been affecting your life in general. Okay, like your sleep, your work, your relationship, your sexual life. Somebody is having back pain. Okay. Somebody is having for chest pain for 6 months. What is that? Okay, chest pain for 6 months it is stable angina. Ask the patient how this is affecting your life in general, your work, your relationship, your sexual life. Do you get any chest pain during sexual activity? So the various aspects, you need to be a little bit go further. Okay, you need to go a little bit further. Okay, that is more important. That is okay. We talk about patient-centered, patient-centered. Okay, yeah, patient-centered. Yeah, yeah. Okay, sometimes management is due to patient-centered. Okay, I'll tell you a thing. Because somebody's having chronic kidney failure, but he's having arthritis. He says, give me painkiller. Okay, don't worry about my kidneys. You need to give him painkiller. Okay, things like that. Okay, yeah, right, good. So, okay, so right, so the effect of symptoms. How to ask the patient how this has been affecting your life in general. Okay, how this chest pain has been affecting your life in general. Is it affecting your work, your sleep, your relationship, your sexual life? So the detailed one for chronic one, long term. Somebody's having back pain from this morning. A 70-year-old man having back pain started suddenly. What we should doing? He was sitting in the chair, suddenly having back pain. 70 years old. Okay, yeah. So what is the diagnosis? He was not doing anything. Okay, just back pain. They started this morning. He's 70 years old, 60 or 70. Okay, I'll tell you one more clue. He's having high blood pressure. Because this is abdominal aortic aneurysm. Okay, abdominal aortic aneurysm. So this one is an acute. So you don't need to ask about this. Okay, how this has been affecting your gender, because you know it. But eyes is important. Concern is important. Expectation is important. You understand? So this kind of decisions you need to make, what to ask and not to ask. Okay, good. That is fine. This is all about history. But don't, okay? So basically the blue, people have an issue. Like asking about occupation. Occupation is important in some places because sometimes the management is related to occupation. For example, if you take a BPPV, the BPP patient is a scaffolder. The reason that put him as a scaffolder. Okay, yeah. Or the epilepsy patient is maybe taxi driver, or maybe, or maybe obstructive sleep apnea patient is a taxi driver because there's a reason they put it. Okay, some situation that may be the only the kingmaker. Okay, the deal breaker. You understand? Yeah. So, okay, be careful on the blue. Blue is a problem. That's why I call them blue. Okay, it is deficiency. Okay, majority of you. Okay, be careful. Okay, no, you have to be very careful on this. Okay, good. So we have done the history part, the important part. Once you finish the history, you mention examination. Okay, when you mention examination, okay, avoid telling these vitals and observation. Okay, some people say, I will take your vitals. I'm going to take your observation. These are medical terms. Vitals and observation, they are not actually, sorry, they are not same actually. Okay, vitals are, that vitals is basically saturation and the pulse. Okay, the observation is other things like blood pressure, temperature. But, they are not the same, and don't use this terminology with the patient. So what we can say? Examination. Okay, so you need to tell, thank you for giving this information. Now, I would like to, write it down. I would like to. People say, I will do the examination. I am coming for examination. What is this? Okay, no, I would like to. Okay, some people say, I will check your pulse. I will check this. I will check this. What is this? I will check. Like, that is not polite. It doesn't reflect on patient's autonomy. Some people say, I'm going to do this, I will be checking this. What I will be checking, where? Checking on who? No, I would like to. Write it down. Okay, listen up. When other people are doing it, correct it. Okay, when you correct other people, you will self-correct it. I would like to do some examination. Okay, it is I would like to do some examination. Not I will be doing it. I will be checking your pulse. I will check. No. Okay, so don't say vitals, don't say observation. Thank you for giving this information. I would like to do some examination. Then you tell that includes, you need to tell, okay, don't say saturation. Okay, that includes your oxygen levels in the body. Okay, there are 4 terms that you use. Okay, write it down and cross: observation, vitals, saturation, and respiratory rate. All these, there are 4 terms. These are medical terms. I wanted to pay attention on tiny, tiny stuff, because this tiny, tiny stuff will make a big difference. Okay, so saturation means oxygen levels in the body. Respiratory means breathing rate. Respiratory rate means breathing rate. So I would like to do some examination. That includes, okay, checking your blood pressure, your temperature, your oxygen levels in the body, your pulse, your breathing rate. So I would like to check. Okay, people think, okay, it's taking time and no, don't worry about it. Okay, if you are a good candidate, they will not wait for you to finish this singing. In the middle, they will tell you, give you the paper, say thank you. Okay, okay, right, good. Right. Avoid this telling head-to-toe examination. Okay, head-to-toe examination, it is bullshitting basically. Okay, what is this head-to-toe examination? Okay, if you say head-to-toe examination, they will tell you you're trying to fool them. Okay, why? Because do you have anything apart from head-to-toe? Okay, I'm going to do head-to-toe. What is head-to-toe examination? Okay, Plab 2 is a focus. You need to tell specifically what you're going to examine. Okay, what is this? Today above the head examination, tomorrow below the toe. Okay, I'm going to do below the toe. What is this head-to-toe examination? Don't do this. I know, I told you, they will think that you're trying to fool them. Because I've been very technical, like in the court, I said head to toe, give me everything between the head to toe. Okay, no, it will not work. Okay, they have the full autonomy to decide what to give in terms of your marks. No one cannot do anything. Okay, never, ever in the Plab history, one examiner's mark has been changed. Never. That is a solid protocol. Never, whatever, even examiner can be eating crisps or he can be sleeping. Never it will change. Okay, for worst case scenario, what they can do, they will give you another attempt free of charge. Okay, even they will count the attempt. Okay, no, they have the full autonomy to go through. Okay, it is, if your bad time, it is your bad luck. That's it. Okay, but you need to make sure that your side is okay. Okay, right. So the head to toe will not work. Okay, so head to toe will not work. You need to be specific. I would like to examine your ear. I would like to examine your tummy. I would like to listen your chest. I would like to examine your feet. I would like to examine your hand. I would like to examine your eyes. So you need to tell like this. I would like to. Okay, I would like to examine. Okay, there are a couple of telephone scenarios. You'll have a finding on the table before you start. There may be ECG or rash. Okay, rash, for example. Okay, for measles, always telephone, and rash is on the table. Some of the palpitations, they can come as a telephone, and the ECG is on the table. If an ECG is on the table and if it is a telephone scenario, what I would like to tell you, read those things before you start. Don't, okay, no need to no, I will take a history, then I will go and see. No need of this. Okay, don't act unnatural. If there is something on the table, read. Okay, look at the picture. Okay, look at the ECG. Or some findings there, read. Then you take a history. After taking the history, you don't need to stop like, okay, let me have a look. No need of this. You need to paraphrase. I understand that we have done an ECG earlier today. I have had a look at the ECG. Understand that you have earlier emailed the picture of the rash. I have had a look at the rash. And you tell the diagnosis. From the information that I have gathered so far, this may be this. Okay, do you understand this one? This is something different. Okay, yeah. Okay, another thing in terms of telephone, not all the scenarios. Okay, you don't need to tell like, if you are here, I will do this. But there is one exception, is bulimia. Everything I say, there is one exception. Bulimia is basically, that is not examination in bulimia. There are two bulimias. One comes as a vomiting, Other one comes as a hyponatremia. There are two bulimias. Okay. The one comes as a vomiting. You need to ask the patient about the BMI. Okay. Your patient will tell you my BMI is 22. Okay, 22 or 24. Okay. In bulimia, BMI is normal. Okay, that is the exception. Except that okay, you don't need to tell if you are here. In telephone scenarios, if you think that okay, if you need to do some examination, including the management, let me explain to you what we need to do, then you explain about it. But okay, in the telephone scenarios, okay, in the physical examination, they don't give in between. But in the management, if you mention we need to do some certain test, they might offer. Okay, that is only one happened with the DKA scenario. Okay, one with but I don't think they will repeat it the same way because it's illogical. It is illogical, right? If somebody is on a telephone, okay, you need to make a decision as remotely. Okay, ask the patient is remotely. Okay, but one DKA, they made it like this. They brought it over the telephone. They gave DKA findings in the examination. Okay, yeah, that is okay. Only for DKA is okay. Okay, yeah, but basically, okay, what is the main understanding is in the telephone, the examination. If you think that if you need an examination, incorporate in the management. Okay, yeah, right. I'll not talk too much about telephones. Okay, but basically, one thing about telephone, if you have a finding on the table, okay, you don't need to stop in the middle. Study before you start. Once you finish the history, you need to paraphrase. I understand you have done this earlier. I have had a look. This is what it is. Okay, good. Okay, in bulimia, it's an exception. You need to mention about the examination. Okay, what I would like to do, we would like to check your BMI. Are you aware anything about BMI? Just after I know this is 22. Okay, they wanted to give that finding. Okay, right, good. So the main thing about the examination is be specific. Okay, not head to toe. The next problem with the examination is you are not telling the findings to the patient. When they give a finding, okay, the specific is important, guys. You need to be specific. If you are not specific, you will not get the findings. Okay, you know that the simulators, they have different clipboards. Okay, different clipboards. Okay, okay, you need to mention if the different clipboards, if you just say observation separately. Okay, then abdominal examination finding in a, because the thing that you need to show that I'm thinking about this. If you don't mention it, you will not mention it. Okay, if it is a ER scenario, if it says I would like to check your ER, they might give you tympanic membrane picture. But if you mention I would like to examine your hearing as well, I would like to do the hearing test, then only the hearing test finding will be on a different clipboard. Okay, in for example, in abdominal aortic aneurysm, if you mention observation, like checking the blood pressure, that's a different clipboard. But when somebody mentioned, I would like to examine your tummy, that finding pulsatile mass is in a different clipboard. You need to be specific. I would like to do, I would like to examine this. I would like to examine this. Okay, they have a different clipboard for this. Meantime, sometimes some people get upset, like I said everything, but I didn't get that orange clipboard. I said everything. So, don't worry about it. Sometimes they have their script as well. Okay, time to time they read their script. Okay, if they're quite new, they need to, it is a part of their protocol because they need to keep the consistency. Okay, like in terms of not giving wrong information. If they're quite new, in order to remind themselves, they can keep it. So don't get upset like I said everything, but I didn't get one clipboard. Okay, yeah. So don't get upset and leave it. Right. The next thing, explain the findings to the patient. It is another thing. Sometimes, in the test results, you may get ticked for findings. If you don't really understand what is, because sometimes they get ticked for findings because you didn't explain the findings to the patient. Like telling the patient, we check the blood pressure is normal, or we check the blood pressure, unfortunately, it is on the high side, or we check the blood pressure, the blood pressure drops when you stand up. or we just examine, you have some tremor on your hand, okay, but you have some difficulties in your walking, okay, yeah, you have okay, I mean, you're telling the findings, okay, yeah, there is some, okay, there is some, okay, changes in your hearing, okay, we just examine, even it is normal, you tell we did your hearing test and which is normal, okay, so explain the findings. Okay, you can get, you might get ticked, okay, in the research sheet for findings. So, okay, for one of the reasons is that not telling. There are many reasons to get ticked. Sometimes if you don't ask the right thing, okay, like in, for example, in psychiatry, if they tick findings, maybe you didn't acknowledge the body language, or you didn't ask about the suicidal. Okay, so sometimes the findings also get ticked in your the test results. One of them is findings. Okay, findings here. The findings get ticked. If you don't, okay, we don't sometimes like don't talk about the finding, or sometimes you don't ask about it. It's not only physical examination, it can be in the history as well. Okay, it can be in the history as well. Okay, right. So pay attention. Okay, every small minor details. Okay, then another thing is another thing that I need to fix this with you. The blood test is not with the examination. Okay, the only test in terms of testing with the physical, we are still in the physical examination, history, examination, then the diagnosis. We are at the moment just above the diagnosis. Okay, when it comes to diagnosis, right? Yeah, when it comes to I mean, just before the diagnosis, you make a diagnosis based on history and physical examination, like a reality. Okay, you don't, doing the blood test is later. Okay, some people do physical examination, and also I would like to do your full blood count, this and that. No, don't say like this. The blood test or x-rays, all these things are investigations. The investigations comes under management. That is after the diagnosis. First you diagnose. In the exam, in the Plab 2, they have given you enough information for you to diagnose, okay, with the history and physical examination. You have been taught to do this blood test before because they don't have a clue. Okay, they don't know this. They don't know, okay, how the system works. The blood test is later. Okay, blood test, don't do the blood test with it. They can only do 3 or 4 tests. Those tests are, okay, it's called bed test. I mean, bedside test. That means it's done by you. You don't need the laboratory. If you need a laboratory for the test, that's come under management. This is clearly simple as it is. Okay, which test you can do, urine dipstick you can do, you take a urine and dip. Pregnancy test is the same. ECG is the same. ABG, we don't need it, but ABG also, it's you process the blood. So these 4, you can do it before the diagnosis. So whenever you need pregnancy test, urine dipstick, you do it yourself. Okay, that is before the diagnosis. But other tests like your full blood count or urea, electrolyte, whatever you have been doing, that has to be in the management. Don't do it before, it is wrong. Okay, I know you have been doing it. I know you have been taught. I know this one for many years. And I know this is wrong for many years. Okay, this is wrong. The blood test, okay, you tell me a scenario, I tell you what are the findings there to diagnose. Okay, some people, okay, because you have a problem with the diagnosis, but I'm going to sort this out. Okay, because, how can we diagnose without the blood test? Your diagnosis is the clinical diagnosis. Okay, your diagnosis is your tentative diagnosis. Your diagnosis is your provisional diagnosis. It is not a definitive diagnosis. You understand? Your diagnosis is, okay, it is, that is your, okay, what is your suspicion? Okay, so if the blood test, they can give you blood test if you ask before if they have it. Okay, but that is wrong. Okay, they might give you. That don't think that is right anyway. But at the moment, you don't have any scenario that they give you blood test based on the blood test you diagnose it. No. In this scenario, guys, if they think you need the blood test before you make before the diagnosis, they will incorporate the blood test with the task, or they will put it on the table. But the good example is hyponatremia. There are 6 hyponatremia scenarios. There are 6. 4 of them in the GP, 2 of them in the hospital. Okay, but all of them, the GP scenarios, that is a very good example that the blood test is incorporated in the task. Okay, and the hospital scenarios too, confusion, hyponatremia, the blood test is on the table from the beginning. It is not given in the middle. Okay, the no scenario, the blood test is given in the middle. Okay, that for you to diagnose. They might give you some ABG finding and all later. That is to add with your management. But in order to diagnose, it is very bottom line. You tell me a scenario, you ask me, I'll tell you. Okay, I will tell you. Okay, every single scenario I know. Okay, so you ask me, I will tell you how it comes. So, okay, no need to, okay, no, this is wrong to do blood test. That is my point. Okay, good. Clearly understand that blood test is later. Okay, I said maybe 3 times, 4 times because I know this need to be fixed. Once you finish the history, you tell the diagnosis. How to tell? First thing, from the information I have, you need to tell the patient, thank you for giving this information. Okay, from the information that I have gathered, you can tell it seems like, it seems like, or this could be. Avoid this suspecting. You are suspecting, but you don't use the word directly, suspecting. This could be. From the information that I have gathered, we think this could be a condition called polymyalgia rheumatica. So this could be from the, thank you for giving this information. From the information I gathered, this could be. Yeah. So, we feel this could be, or this could be a condition. Mr. Johnson, from the information I gathered, we feel this could be a condition called, you tell the name, pericarditis. First you tell the diagnosis. Now we are moving into management now. The rest of the things, the next 1 hour, I'm going to talk, everything is about management. The management start with finding the right diagnosis. The next 1 hour, I'm going to talk about entirely about management. What is really management, how to improve, what we need to include. Right. The first thing you tell, you need to remember this, the first step approach in the diagnosis. Tell, ask, explain, and check. Tell, ask, explain, and check. First thing you tell, the name of the diagnosis. Some people have a bad habit like explaining, then we call this condition this. No. If you have been doing like this, then you are weak. You are not up to the standard yet. First thing, you have to abruptly, randomly tell the name. From the information that I have gathered, it seems like, we feel this could be a condition called, tell the name, pericarditis. Or from the information I gathered, this could be a condition called Meniere's disease. First you tell, from the information, I have gathered so far, this could be a condition called depression. Next one, ask, have you heard about it? This way you are making interactive now. Do you know anything about it? After telling the diagnosis, you need to ask the patient, have you heard about it? Some people make a mistake. They wanted to ask, have you heard about it? But they choose a wrong phrase, how that sounds to you. You cannot ask like this after telling, you have, this condition is depression, how that sounds to you. Obviously, it doesn't sound good to me. So you don't ask this, how that sounds to you. No, have you heard about it? Plab 2, guys, you need to learn to talk. Actually, it's a robotic talk, but you shouldn't sound robotic. Okay, but the talk is robotic. If you learn this one, you can smash it. Okay, I'm just going to tell you, show you some of the management results of my past students. Okay, look at it, because before I talk about management, I need to show you to you for your motivation, not for marketing. Okay, I don't need marketing. So this is for motivation. Okay, look at this one. Okay, this one 16, that's fine. But simply look at the management. Okay, look at the management now. People suffer with the management. Management is more than interpersonal. Management is more than data gathering here. Why? Why? Because they understand what is management. Look at this management. There is no one. There are a couple of twos. Okay, there are too many fours. So how many? 1, 2, 3, 4 fours. Okay, but it's simple. Okay, it's a simple one. Okay, that is one. Okay, yeah. So, but look at the management. What I surprised, but I like it. Management is more than that. More than data gathering, more than interpersonal. How is possible? Okay, look at this one. Okay, this one. Okay, this one, because person is really good. Okay, but look at the force. How many force in the management? You can look at the management, there's no one. There's no single one. How many two? I think there's only one. There's no two either. There's 1, 2. Okay, there's the 1, 2. Okay, rest of them are 3 and 4. How many fours? 1, 2, 3, 4, 5, 6, 7. So almost half of the scenarios out of 16. Okay, the pass marks for in this day is 100. She got 166. Okay, look at the situation. Okay, yeah, look at the situation. So look at how many 12s. When the exam is happy with your entire performance, they will put marks in all domains. But look at more than half of the scenarios for management. Why? Because they understand management. So because before I start management talk, okay, I need to motivate you with this. You need to, the thing is, you need to have a confidence in this one. Okay, you need to have a confidence in this one. Okay, good. So, right? So this is all about management. Okay, you look at the management. It is either 3 or 4. Okay, look at this. Okay. Then we have another one. Another one. This one also the same situation. Okay, all 3 are my students. Okay, right. Then nowadays the past 16 scenarios is a little less. Because you know why? 1 or 2 scenarios are quite new and it's too many scenarios. Okay, it's a bit challenging, but okay, people can take it. Okay, yeah, but 16 for the last 2-3 months it's a little bit tough. But yeah, but that's okay. Okay, that's okay. Okay, we don't need 16. Okay, we don't need 16. Okay, look at this one. Okay, this one is actually a boy. He has done very well. Okay, done very well. But the thing is, what I am surprised, there's no one. The only one is okay, a couple of 2s. Okay, but yeah, look at the management marks. What I like it here in this one is the 48. The management is more than the data. Do you see? So see. So you need to understand what is management. Okay, let's learn what is management. The first thing, having the right diagnosis management. Okay, yeah, first thing. Then, okay, follow this structure. You tell the diagnosis, tell the name. Okay, from the information I gather, this could be a condition called, okay, Meniere's disease. Have you heard about it? Patient definitely going to tell you no. Okay, now explain, give the definition. Let me explain to you. Write it down, this phrase. Let me explain to you. You explain. You have to give the definition. Okay. Next thing is about how to give the definition. Okay. The definition, some people look at, okay, they might, when you go to your academy, they may discourage you. You don't need to tell what is depression. The whole world know what is depression. No, that is wrong. That is so wrong. They don't have any clue what they have been doing. Okay, first thing, okay, you go to NIST guidelines and see every scenario they work on definition. Okay, there is a part called definition. Go to NIST guidelines and check every single scenario. They are trying to defining something is management. Okay, definition. It can be simple depression. It can be an epilepsy. It can be ARMD. It can be cataract. You have to explain definition. Okay, giving a definition is management. Okay, definition. We have to work on your definition. But in order to work on your definition, you cannot memorize. You need to have a system. So what is a system for definition? Learn three steps or three sentences. First thing, you need to tell where is the problem. Okay, leave psychiatric conditions. Psychiatric conditions, we talk about the experiences. Okay, yeah. So forget about psychiatric. Okay, think about the other organic conditions. Okay, so first thing you need to tell where is the problem. Okay, if it is epilepsy, it's a condition of the brain. Okay, if it is a Meniere's disease, it's a condition of the inner ear. Okay, so if it is you need to tell where is the problem. Okay, if sometimes a condition of the lungs, a condition of the bowel. Okay, so we need to look. First thing, you need to let the patient locate the body. Where is the problem? Okay, it is ARMD. It's a condition of the back screen called retina. Okay, so where is the problem? First thing. Second thing, what is happening in there? What is going on? Okay, that means what is going on? Simply, the most common is inflammation. Can we say inflammation in Plab 2? You can. Or if you wanted to say more specifically, swelling. Inflammation is swelling, but inflammation is okay. Okay, inflammation is basically swelling. So there are 5 different things can happen in the organ in terms of, okay, when you explain condition. Either inflammation or infection or inflammation due to infection. Okay, the third one is the common one is autoimmune condition. It is an autoimmune condition. Okay, yeah. Then what is the fourth one? Okay, abnormal function, altered function. There are some conditions, okay, certain organ has got altered function, abnormal function. Trigeminal neuralgia is an example. Epilepsy is also kind of this one, but that is the abnormal electrical activity. Abnormal function. Okay. Irritable bowel syndrome is a sort of abnormal function. Okay, so could be a functional condition or abnormal function. Chronic fatigue syndrome also you can pull into that kind of thing. Okay, yeah. Then the last one is the tumor. It's a growth. Okay, yeah, either any of these things. Okay, so you need to tell where is the problem. Then you need to tell what is happening there. Okay, yeah, what is happening there. So it is a condition of the brain. Okay, in the brain there is some abnormal electrical activity that manifests as jerky movements. That is epilepsy. Okay, so you need to tell. Okay, what is Parkinson's? It is the condition of the brain that that affects the movements of the body. This is due to lack of a substance called dopamine in the brain. So, okay, this is how you need to explain. Okay, what is polymyalgia rheumatica? Okay, you need to work on your definition, guys. That is the first step in terms of improving your marks in the management. Definition. Okay, definition is crucial. A doctor should be able to define. Okay, a doctor should be able to define. Okay, what is endometriosis? Okay, so a doctor should be able to explain. Okay, definition. Okay, what is polymyalgia rheumatica? Okay, what is polymyalgia rheumatica? Okay, it's basically it's a condition of the large joints and the muscles surrounding it. Okay, what is happening? There is an inflammation going on, swellings. Okay, so the idea is this. Okay, what is tuberculosis? Okay, tuberculosis is the infection of the lungs. So the way I said it is, look at the last one. It is an infection of the lungs. Okay. So the thing is, the what is happening there and where is the problem? You can simply combine if it is a very simple one. Okay. What is sinusitis? Okay. You don't need to tell about what is it's a condition of the sinus. Okay. No need. You can combine this together. It is an inflammation of the sinuses. You understand? So what is transient ischemic attack? So, okay, there you cannot combine. It is a condition of the brain. Okay, people develop this one due to interrupted or disturbed blood supply to the brain cells. Okay, so where is the problem and what is happening there? Okay, yeah, but some places you can easily, simple ones you can combine. So if it is a tuberculosis, okay, or pneumonia, you can try simply a chest infection. This is an infection of the lungs caused by a bug called Mycobacterium tuberculosis. Okay, so you need to tell where is the problem and what is happening there. Okay, definition. Okay, what is obstructive sleep apnea? It is a condition of the airway. Now you will tell what is happening in the airway. The airway collapses. Okay, the throat muscles collapses during the sleep and that closes the airway. That wakes people from the sleep. Okay, this is obstructive sleep apnea. Okay, yeah. So you understand, the first thing is locate the body part. Then try to explain what is happening there. What is the third thing? Risk factor. Okay, you need to tell the risk factor. Okay, you mentioned to me you had a recent travel to Thailand. Okay, so infections like tuberculosis is quite common in Thailand. Okay, so tell the risk factor. You mentioned to me you have been taking contraceptive pills. Okay, so that increases the risk of developing this condition. So if there is any obvious risk factor, that should be the third one. Okay, do you understand this structure? Yes. So you need to tell them, okay, where is the problem and what is happening there? Okay, where is the problem and what is happening there? Okay, what is ARMT? So it is a condition of the back screen called retina. Okay, so we call this as age-related macular degeneration. You need to tell macula is the central part, and it gets quite common in old age. Okay, so degeneration means the nerve cells, they are losing the ability to function as usual. Okay, they are losing their function. Okay, so the middle part of the retina called macula is affected. Okay, what happening? The nerves in that area, okay, they're losing the function. Okay, they're losing the ability to function as usual. Okay, that is degeneration. Okay, they will ask you. Okay, so definition. Okay, sometimes definition you cannot give like a bullet. It's okay to have a couple of sentences and explain. But definition, the thing is, definition shows that you are understanding. Okay, that is explaining something to a patient is management. Every scenario, there will be something to explain. Either definition, or either procedure, or clinical explanation, or ethical explanation. Okay, clinical explanation means simply explaining why a DK patient needs a hospital admission. Okay, ethical explanation means why you cannot change someone's notes. Okay, so you will have something to explain. You need to focus what sort of things. This one I call that the monotalk, not monotonous, monotalk. Monotalk means like in every English exam you will have something that you need to continuously talk. Okay, that kind of things. In Plab 2 also you have things. Either you need to give a definition or clinical explanation or ethical explanation or procedure. Something you will have. Okay, let's go back to this one. So you will tell the diagnosis, ask the patient, have you heard about it? Please follow this one. Okay, you need to ask the patient, have you heard about it? Let me explain to you. Give the definition. Once you finish the definition, what will you do? Check understanding. Okay, how to do the checking understanding? Okay, use the very simple, smooth ones. Like, do you understand? Is it clear? Okay, these ones. Okay, do you understand? Do you understand? But you need to be nice because you have given a chunk of information. Like you need to act like, like it is difficult to, it may be difficult, but never say, I'm so sorry, a lot of medical terms I'm using. Never say this. They see this as a weak one. Okay, never. Like, I'm so sorry about the medical terms and don't worry about, no. Rather, you do like this. Okay, do you understand? Is it clear? Are you able to follow me? Only use this ones as a checking understanding. Only use, okay, I'm so strict on this. My job is to tell the right thing. Okay, your job is to, okay, it is choose it or not, but I wanted you to choose this. Checking understanding is going to be every scenario. Okay, every scenario. Okay, you will have a checking understanding. Checking understanding is patient, it is management. That is interpersonal too. Okay, do you understand? Is it clear? Okay, are you able to follow me? But you need to ask. So, okay, but avoid this. Are you following? Are you following? Okay, no. Okay, it asks like this. You need to, a doctor should be a nice person. So how to ask? Are you able to follow me? Do you understand? Is it clear? Is it clear so far? Do you understand this? Okay, yeah, ask like this. Okay, ask like this. Is it clear? Okay, do you understand? Now I'm going to tell you, avoid the way that you have been doing. How that sounds to you? Okay, are you getting my point? These ones are not wrong, but they are not the best. Okay, they don't sound so natural. Okay, how that sounds to you? Now, how that sounds to you can ask, like if we give some option of doing something. Like we will advise you to do a regular exercise about 30 minutes for 5 days. How that sounds to you? Do you think that you will be able to manage this? You can ask like this, but not for explaining something. Okay, not okay, yeah. How that sounds to you? Can you change this one? Okay, we don't. Why you are going to complex ones and doesn't make sense? Are you getting my point? Are you getting my point? Is casual. Okay, are you getting my point? Like Imran Khan should have stayed with America. Do you get my point? Like two elderly people, two uncles, when they sit down and talk politics. Do you get my point? We should have done this. Okay, yeah. So it's not wrong, but it's not okay. It is very palatable. It is not. Okay, use the simple one. Okay, learn this one. Repeat. Do you understand? Is it clear so far? Okay, are you able to follow me? The checking understanding is management, it's interpersonal, and it is going to be every single scenario. Okay, after today, I'm not going to talk about this one. You need to learn, write, and practice. Okay, good. The next thing is the wrong thing. Okay, wrong thing that I need to tell you when it comes to diagnosis. Okay, let's go this one. Okay, when it comes to diagnosis, don't try to justify. Don't try to summarize. That is a wrong way of doing, okay, diagnosis. It is another big thing that you are here to make some changes. You are here to knowing that we do something differently, and you know that. But if you cannot change these basic things, it is no point you being here today. Okay, which one? This is a big ask, I know this, but this has to change. This is summarizing in your diagnosis. Okay, like justifying. Okay, people, what they do, I've been doing is, okay, after taking the history, you told me you are feeling dizzy for 5 days, and also you have some hearing loss, and you also lost some balance. So this may be a condition. No, you don't need to do like this. That is what I have written. You don't need to summarize. You don't need to justify. Some people try to justify because you told me this, so I'm giving you this diagnosis. So examiner, you cannot fail me. No, it will not work. That is not the way of doing it. Okay, you don't need to justify. You understand what I mean by justify? Because you are trying to justify by summarizing what? By summarizing the symptoms. You don't need to summarize it. Okay, you don't need to tell why this is Meniere's disease. You need to tell what is Meniere's disease. Start thinking. It is different. Okay, you don't need to, okay, you need to pay attention here. We do things differently. Not we do things, we do things, okay, appropriately, not differently. Okay, this is the right way of doing it. You don't need to justify. Okay, if someone comes with a depression, you don't need to tell you have been feeling low and you have been doing this and you have lost some weight and blah blah. No need to summarize. Okay, somebody comes with a tuberculosis, you take a history. After taking the history, you mentioned to me you have been having cough and you're also having some fever. You don't need this. You don't need. Thank you for giving this information. From the information I gathered, it seems like you have a condition called tuberculosis. Have you heard about it? No, let me explain to you. Tuberculosis is an infection of the lungs caused by a bug called Mycobacterium tuberculosis. You mentioned to me on a recent travel to the Philippines. Okay, countries like Philippines is quite common. This infection is quite common. They are called endemic areas. Do you understand? Is it clear? Clear. Now you jump into the management. We are jumping into the management. When you jump to the management, again, avoid saying this. Do you want to know what are we going to do for you? Because this is so annoying. I don't know why you have learned. This is not reflecting on patient's autonomy. This is annoying. Do you want to know what are we going to do for you? The simulator will look, okay, what is this now? I don't know whether should I say yes or no. Simulator will look at the examiner will look at it. Everyone keep on, no need of this doing this. Okay, this is nothing. I don't know what it's this. Okay, this is it's so annoying. We don't need this. Okay, do you want to know what are we going to do for you? Okay, because you have to lead the talk. Okay, this is going to waste your time as well. Do you want to know what are we going to do? Yeah, patient also, yeah, I want to know. Okay, we don't need this. You lead rather. Okay. Okay, and also avoid saying which one, because we have some couple of options. We don't have a couple of options. Okay, we don't have a couple of options in every management. Only 2, 3. Okay, like a skin lesion, you may have a couple of options. Okay, there are some other things as well. Okay, usually we have a combined things to do. Or we may have first line and second line of treatment. Okay, if the first line is the treatment, you talk about first line of treatment. If the patient already tried the first line of treatment, you talk about the next thing, the second line of treatment. Okay, it is not like everywhere we have a couple of things. Avoid this, we have a couple of things. These sentences, you need to write it down in your notes and cross it over. Okay, do you know what are we going to do for you? Okay, and okay, we have a couple of options. Okay, in depression, people talk, we have a couple of options. We don't have a couple of options. That is a combination of variety of things. Okay, I'll tell you how to start the management and write it down. This is a golden sentence. Let me explain to you. You lead the talk. Okay, in the management, you need to be so quick. Okay, just don't wasting time. You need to give a chunk of information, check understanding. Chunk of information, check understanding. Chunk of information, check understanding. Okay, yeah. So okay, you need to utilize it very economically. First thing in the management. The second thing in terms of management, don't wait until the 6 minutes for management. Some people think, okay, the last two minutes was management. No, the 2 minutes bell is to tell you you have 2 minutes. Okay, that is the purpose of 2 minutes bell. 2 minutes bell. 2 minutes bell doesn't. Okay, it's not there to tell you start management. So my advice is that You don't need to wait. Okay, like 6 minutes. No, the management, actually the definition, when you hear a 2 minutes bell, you may be talking about the explaining the definition. Okay, that is the right time. Okay, so start earlier, management, and you lead the talk. Let me explain to you what we need to do for you now. Okay, write it down. Let me explain to you. Okay, let me explain to you. Let me explain. Okay, talk like this. Okay, can you please avoid this one? Okay, do you want to know what are we going to do for you? Okay, that is so annoying. Okay, this is not, I don't know what it is. I don't know where this originated. Okay, we don't need this. There's a couple of options we don't need. Okay, contraception, we have a couple of options. Skin lesion, we have a couple of options. Apart from that, I don't think anywhere we have a couple of options. Okay, no, it is a combination. Okay, usually treatment either combination or we have a first line or second line of treatment. Okay, so why saying this one, we have a couple of options. Okay, it is simply, let me explain to you, okay, what we need to do for you now. You go and explain step by step. In terms of management, you need to have your own structure. Okay, you need to formulate the management plan. Okay, in some telephone, you need to include the examination. Okay, that depends. So in terms of management, you need to think about all these things. Okay, first thing, you will explain what type of condition. Okay, what I mean by that in the first thing is, what type of condition, first thing. If something is an emergency, you need to talk about that first. Management, in the management, priority is important. You need to talk about the most important thing that is necessary now. Okay, in the management, the most important thing. So, for example, if like in terms of management, 50-50, that means 50% of the scenarios that GP manage. Okay, then there may be 50% maybe emergency or referral. Okay, so if something, okay, something is quite important, first thing you need to talk about it. Okay, if it's an emergency, you need to tell it is a medical emergency. Okay, you give the explanation, you check understanding. Okay, you need to tell, okay, unfortunately, this is part, okay, it is a medical emergency. Okay, things like, okay, carbon monoxide poisoning, or it's a stroke, or it's an unstable angina. You need to tell, unfortunately, Mr. Johnson, this is an emergency now. So, okay, then, okay, you need to tell, okay, where is the patient is going next? Maybe, okay, we'll advise the patient to call an ambulance. Okay, some people ask, like, if it is something like serious, we need to call the ambulance in the beginning. Okay, then we talk, no. Even somebody having a MI or PE or anything, you sit down and talk. No one is having it. Okay, it is a scenario. We need to have a logical structure. So, okay, when it comes to management only, you talk about it. Okay, like some people have this one. Okay, if it is MI or maybe PE, okay, do we need to stop everything, call the ambulance, and then we will need to discuss with the manager? No. Okay, don't be chaotic like this. Okay, it is an exam and no one is having, okay, any MI. We need the structure. You take the history, make a diagnosis, explain, then you tell, unfortunately, it is an emergency. So you need to tell emergency, there are a variety of emergencies. There are emergencies, you call the ambulance. Okay, that is one. The second emergency, you tell the patient, you go to the hospital. Okay, like schizophrenia. Okay, MI, you call an ambulance. Unstable angina, you tell the patient to go to the hospital on your own. But there are some other type of emergency. Third one, you doctor make an appointment and send the patient, like TIA. For example, TIA, you make a appointment in a TIA clinic, you send them. Okay, or which one? GCA. You get an appointment in the rheumatology and you send the patient. Okay, so there are three types of emergency. One, you call the okay, you tell the patient to call the ambulance and go. Okay, that I mean, if it is at home, you tell the patient to call an ambulance. If it is in the GP, we call the ambulance. Okay, the second thing, you tell the patient it's an emergency like a carbon monoxide poisoning. Okay, we will advise you to go to the hospital. Or the third one, it is an emergency, but we'll give you some medications right now. But okay, we will get an appointment in the specialist clinic within 24 hours or 3 days, and okay, you will be able to go there. Okay, yeah. So all the other one is kind of referral. I mean, okay, rest of them. Or you treat in the GP. Okay, if you are treating in the GP, you don't need to tell that we can treat here. You just explain what needs to be done now. Okay, if it's a referral, you need to tell. Okay, for this condition, we would like to refer to the specialist. While you're waiting for the specialist, we are going to run some tests. The next thing you need to focus here is, okay, the confirmation test. Plab 2 is a medical exam. Okay, it is licensing exam. Okay, they are giving you license to practice medicine in another country. Okay, so it is a medical exam. You need to have a solid medical knowledge. Okay, it is not like it used to be. Okay, maybe, may not be. Okay, yeah, you go and speak some English or you pass. Okay, yeah, they might tell you, your seniors, those have done Plab 2 like 3-4 years. It's a Plab 2, it's an easy exam. I just practice 2 weeks, you will be okay, don't worry. No. Okay, now they're very solid. Solid, you need to have communication, you need to have a medical knowledge. You need to have both. You need to have critical thinking as well. Okay, you need to improve your critical thinking, decision making. If they have seen you have trouble in decision making, but the decision making you can learn. Okay, logically you have to learn. Okay, that can cause you trouble. Okay, but it's very simple. Plab 2 is a serious exam. Okay, but it's not difficult exam in terms of the content. Okay, it's not in terms of content. Compared to USMLE or Australian or Canadian, it's not difficult content. Now its content is a little heavy. Okay, yeah, but it's a serious exam. Everything has to be appropriate. They need to satisfy. You need to satisfy them. Okay, you can practice medicine. Okay, you need to satisfy 16 people. Okay, good. So, but it is easy to satisfy them if you learn the basic things. You need a confirmation test. Okay, that is why I started talking. A doctor should know how a TB is, for example, is confirmed. Okay, a doctor should know if somebody is suspected suspected Meniere's disease. Okay, somebody is having Meniere's disease. Okay, somebody is having Meniere's disease. How to confirm? They should know. Okay, if somebody is having meningitis, you should know how meningitis is confirmed. Meningitis is confirmed with the PCR test. Okay, you should know how PCP is confirmed. PCP is confirmed with the PCR test. Okay, so you should know the confirmation test. How this condition is polymyalgia rheumatica is confirmed with ESR and CRP inflammatory markers. Okay, you need to know that. Okay, and you should know that. Okay, for example, ankylosing spondylitis. Okay, what you need to do, for example, okay, you need to do the HLA-B27 test. Then you need to refer. Okay, then you need to refer. Okay, then you need to refer. So you need to know that what sort of confirmation test is there. Confirmation test you need to know. Okay, for example, polymyalgia, chronic fatigue syndrome is confirmed by referral. Okay, you should know this. So, okay, confirmation test. You need to know the confirmation test, how this condition is confirmed, how we confirm. Okay, once it is confirmed, the next thing, okay, how this condition is treated. Okay, how this condition is treated. There are two things when you wake up in the morning. Okay, until you finish the Plab 2, you need to remind yourself because of the wrong teaching and wrong ideas in your head. this may confuse you every day. The first thing you need to remind yourself in Plab 2, in clinical cases, the diagnosis that we are making is your provisional diagnosis. Okay, the management is giving information. Okay, because you always have that. Am I treating or not? Okay, you'll always ask me, like, no, in the GP, are we treating or not? Okay, the thing is, if you are, it's not about, okay, the first thing is not about treating or not. It is about how this is treated. Okay, how this condition is treated. If this, you have this condition, how, okay, Parkinson is treated. Okay, how this condition is treated. Okay, how polymyalgia rheumatica is treated. Okay, how Meniere's disease is treated. Okay, so the thing is, you need to know the treatment methods. Okay, what are we going to treat? You need to know the name of the medications. I know that you have been discouraged not to know the name of the medication. It is so funny. Okay, if you look at the infection-related scenarios, okay, if you look at it and do a deep research, why most of the infections, they are allergic to penicillin. In particular, patient is allergic to penicillin. Otitis media allergic to penicillin. Syphilis patient is allergic to penicillin. Why? It's just allergy. You need to check allergy. Yeah, you need to check allergy in the history, and also you need to know the right management. You need to know the name of the medications you have been discouraged not to know. You need to know if somebody, for example, if syphilis, okay, and somebody is allergic to syphilis, allergic to penicillin, what is the treatment? That is doxycycline. Okay, it is going to be a 1 month of treatment. You need to know in terms of medication, you need to know two things: the name of the medication and the duration. Dose, you don't need to. Dose is not safe. But the duration, because the patient generally have a question, how long I'm going to be on a treatment? Everyone is curious to know. Is a lifelong treatment or 1 or 2 years of treatment, 1 month treatment, 2 days of treatment? Some scenarios based on the duration of the treatment. Okay, in order to understand, you need to think and analyze variety of scenarios. Some scenarios, the patient will ask you, how long is the treatment, doctor? Okay, why this is 3 days now? Or why this is 5 days? Okay, yeah, the duration and the medication name is important. Look at all the headache scenario, guys. Okay, if you are not happy, look at the old headache. If you look at all the headache scenarios, if you look at it, the patient will come to you after using the first line of treatment. So they are expecting you to know the second line of treatment. Okay, I cannot give you more than evidence like this, that you need to know the name of the medication. You have to know the name of the medication. In depression, patient is asking, okay, can you give me a medication that doesn't affect my sexual function? Okay, in trigeminal neuralgia, if you don't give the right medication, patient will ask you, are you going to give me something strong? I cannot give you more example than this. You need to know the medication, the duration, the how long is the treatment. You need to know this. You need to study. A doctor should know. Okay, general, what is the medication for this condition? You need to know. Okay, you need to know that. Okay, you need to know a breastfeeding mother with chlamydia, this is going to be azithromycin. You have to know this. Okay, you need to the level up the standard like this. Then other medication. Okay, some scenarios you may have some other medication. For example, if you take a migraine, the migraine management, you will discuss 3 medication. Okay, the main treatment is going to be sumatriptan. When you give a sumatriptan, somebody with a migraine, regardless, they have a, so that is the main medication, right? So what are these other medication you're going to discuss? For example, let's talk migraine. The second thing, you must give metoclopramide. That is the guideline. Okay, regardless patient have a nausea or vomiting, you must give. Okay, yeah. Not only that, then there is a prophylaxis. That is propranolol. Okay, but when you take a history, the protocol to give propranolol, if patient is having more than 1 episodes per week, okay, more than 1 episodes of headache per week, That is the protocol to give propranolol. But you take a history. Patient had only one headache in the last 1 month. In the last 2 months, 2 times. But the patient is not fitting for propranolol. Is it fitting? No. But this is how you need to be technical. You can learn how to incorporate the knowledge of propranolol here. So the patient is not fitting. So after the exam, when I ask you, did you talk about prophylaxis? No, I didn't talk about it because patient had only one headache in the last 1 month. Now, that is not the clever way. You need to tell the patient if you develop more than 1 episodes in a week, you may benefit from taking preventive medication. There is a preventive medication called propranolol. So do you understand how to cleverly bring this? Okay, that is the way. The most of the time you need if that confirms. Okay, in the management, you need if clause. If that confirms, this is how we're going to treat. This condition is treated like this. So management is what? Giving information. Okay, it is not about this patient is treated or not. Yeah, sometimes you need to do the right thing. Okay, yeah. But you need to know that the first line or second line of treatment. So what needs to be done next? Okay, right. So, okay, yeah. Then the last bit, this is okay, the purple ones. Okay, the purple ones, I call them, the last one, I call them as a latter part of the management. It is a blue management. That is advice. Okay, like, how patient can make things better, put safety netting. In terms of safety netting, you have a very good understanding. One thing, you give safety netting whenever you leave the patient alone. Number one. Second thing, you need, this second point is very crucial. You have been having wrong understanding. You give safety netting for the adversity, the complication of the condition, for the adversity. For example, okay, somebody comes with the sinusitis. In the eyes, you ask the patient, okay, what do you think could be the cause of your headache? Patient will tell you maybe brain tumor. When it comes to safety netting, if you put a safety netting for brain tumor, it is wrong. Do you understand why? Okay, it is wrong. I'll tell you why it is wrong. Why it is wrong? Because sinusitis will not become headache, brain tumor. Will it? No. Okay, because I put safety netting because patient is worried about brain tumor. So I put safety netting. If you have any weakness, come to us. No. That is wrong. Which is wrong. Okay, no, you are weak if you do like this. Okay, that is not the way you do safety netting or management. In the management, you need to explain, okay, well, okay, it doesn't seem like brain tumor. Okay, because you need to tell, okay, somebody with a brain tumor, they comes with this. Okay, they will have a neurological problem, weakness, speech problem, swallowing problem, things like that. But you put safety netting for what? The complication, I need to understand this point. Okay, if you don't do this, okay, don't do this. You have been doing this because you think this is how you do. That is so wrong. That is, okay, you're going to be a weak candidate. Okay, because you just do like this, because patient is asked, okay, some places, they only take patient concern. What is this patient concern? Patient concern is a small part. Okay, you need to have a plan. So in this sinusitis, let me finish this scenario. Okay, you need to put the management for what? Okay, you need to put the, safety netting for what? What is the complication of sinusitis? Sinusitis can cause, meningitis. Okay, then you put the safety netting. Okay, if they're not settling, if you develop any rash or feeling unwell, okay, yeah, confusion. Okay, if you get any of this, that may be signs of meningitis. You understand? Yeah. Okay. There is a urticaria rash scenario. the mother will ask you, okay, this meningitis. Okay, because we talked about meningitis, I'm going to this one. Urticaria, mother will ask you, is it meningitis? If you ask her why, because the school wants to know. So you need to explain, okay, this is not meningitis, because meningitis rashes, okay, will be like a spots and it will not disappear after a few hours. It stays in the body. So it doesn't look like meningitis. But do we need to put safety netting for meningitis? No. You know this is urticaria. So urticaria, what is the complication of urticaria is anaphylaxis. Okay, do you understand? So okay, if a child develops swellings in the body, like swellings of the lip or eyes or tongue, having any breathing problem, you need to call an ambulance. Think about this too, okay? Example, okay, what to put safety netting. I've given you two good examples to think, because this is another thing you have been doing. Patient asks for it, okay, I put safety netting for this. No. Okay, if the patient thinks is it pancreatic cancer, you tell, okay, it doesn't seem like pancreatic cancer. Okay, that's it. Okay, you need to be so clear on your decisions and information. It is not like, okay, like talking about everything. You need to know, okay, how to say which one is no, which one is right, which pathway we need to think. Learn about these things. Okay, then talk about advice. Okay, in terms of advice, you need to learn how to give advice. Okay, people don't know how to give an advice. When you give an advice, another thing, write it down, this word. Okay, it is better too. Okay, not like you should. Okay, you should do some exercise. You should eat healthy. Some people talk like speaking to a school kid. Okay, you should is not good. Okay, when you give an advice, it is better. It is advisable. It is advisable. Okay, we advise our patients to do some exercise. It is better to avoid driving. Okay, you shouldn't drive. No, it's better to avoid driving. Okay, Englishman will tell advice like this. Okay, yeah, that is we do the serious talk. It is better to avoid driving. Okay, we don't really advise someone to continue to drive. Okay, if they have epilepsy. Okay, you need to watch on your language. Okay, not you should. Okay, so when you give an advice, better to. Okay, there are some certain things you can do. Okay, in order to improve your mood. Okay, there are certain things you can do by yourself to reduce the risk. For example, okay, you may start eating healthy. So you may. Okay, it's better too. Okay, yeah, the language has to be a soft and smooth language. When you give an advice, pay attention when you give an advice. Okay, then follow up. In terms of follow up is a difficult part. You don't decide on your own business. Okay, you don't decide based on your own business. Follow up is a niche guidelines. The niche guidelines will tell you when you need to follow up. It is a difficult one. Because how can you remember? There are so many scenarios. But the common ones you need to know. For example, polymyalgia rheumatica, initially followed up monthly. Okay, hypothyroidism. Okay, follow up in every 3 months. Okay, some abuse related situation, okay, you can follow up the patient in 2 weeks' time. All the abuse scenarios you have to follow up. Right? Yeah. For example, depression. Okay, depression, young people follow up, okay, less than 31 weeks, more than 32 weeks, in 2 weeks. So you should know some follow-ups, like, postnatal depression in 1 week, follow up. Okay, if there is Meniere's disease, no improvement, follow up 1 week, no improvement, come back 1 week. Okay, BPPV. Okay, if there is no improvement in 1 month, okay, then apply in the ENT. So things like that. Okay, If somebody have a simple benign tinnitus, somebody comes with the tinnitus, can be unilateral, bilateral, but benign. That you should know, she will ask you in this scenario, I might do it this later. When are you going to see me again? That is 6 weeks. That is 6 weeks. So you should know, some of them I just gave you the important ones. But but you need to know roughly when to follow up. At least you need to know, you'll follow up in a few weeks' time. Follow up is a difficult one because you need to know accurately when to follow up. Right. Also, you need to tell we don't need to follow up if you don't need to follow up. For example, measles, you don't need to follow up. If it's some UTI, you don't need to follow up if the patient improves. But so then not only just you say follow up, you also need to tell them, that if they don't need to come in, tell we don't need to see you again. We don't need to arrange any follow up. You should be fine. But at the meantime, there is anything that like this, you need to come back. Next thing, leaflet. Leaflet, the good candidates, they give leaflet. When you give a leaflet, it's the right finish. It is the right finish is the leaflet. Some places they have told you, you can only give leaflet if there is a leaflet there only. No, that is a wrong understanding. It is not like this. What is this? Which scenario they print and keep leaflet? No, giving leaflet is a concept. That giving information, this is a Western concept. Giving information for patients to read. So you need to tell, we will give you some information for you to read about the condition, about the treatment, about the testing. You tell this. The giving leaflet, in the NICE guidelines are written for doctors. The NICE guidelines took us time and it has written, give information for the patients to read. And they also will tell you where you can get this information. The leaflet, the idea, you tell the patient, giving leaflet is an idea. You tell the patient, we will give you some information to read about it. The last 3 bit, patient people have a problem. Guys, work on it. The good candidates, give leaflet. Be a good candidate. That is all about management. If you don't adhere to this, I call them as tuk-tuk management. You may heard, tuk-tuk management. Tuk-tuk management, it's basically why we call tuk-tuk management. I'll tell you, for example, let's say, it's mainly for the referrals. For example, if you are referring, let's say Meniere's disease. If you are referring, you need to tell, where are they going? What is the department? When are they going? What is the specialist is going to see? ENT specialist. Then when you go there, you need to tell what test they will do to confirm. So you need to know the confirmation test. You need to tell they will do an MRI scanning. If it is MRI scanning, MRI scanning. CT scan, you need to say CT scan. Ultrasound mean ultrasound. We don't need this jelly scan. No. What is this jelly scan? Maybe somewhere in the north, some village. Not in the south. Not everywhere. No need of this. It is ultrasound, everyone knows. It's an ultrasound scan. Or CT scan. So if ultrasound is a jelly scan, what is this? MRI is an oven scan. No need of this. Just simply say, it is an ultrasound. Ultrasound scan. So they will do a scanning. So what to anticipate? So where are they going? When are they going? What is the name of the specialist? What sort of test will they to confirm this? When you go to the hospital, what will they do? If it's a tuberculosis, you tell the patient, we will advise you to, if it is the GP, we'll ask you to go to the TB clinic today. You'll be seen by the TB specialist. What will they do? They will take some phlegm from your throat, some fluids. And what will they do? They will culture it, they will grow. Is there any bugs? If there is any bugs, it will grow. In the meantime, they will ask you to self-isolate at home for 3 days. Okay, so how will they confirm? Once it is confirmed, how will they treat? This condition is treated with this medication or surgery. How long is the treatment? Okay, yeah. So, okay, what sort of things that you need to look for? So, okay, yeah, this is the management. If you don't do this one, okay, you do the other way. What will they do? We will refer to the specialist. Okay, they will do some test. Then they will treat accordingly. This is tuk-tuk. Okay, yeah. So why we call this tuk-tuk? Okay, I'll tell you. Because I created this term tuk-tuk in order to not to laugh at people, to create the awareness. Why we call tuk-tuk is every country, tuk-tuk, South Asia, they have tuk-tuk, rickshaw, auto rickshaw. Yeah. These guys, these drivers in the town, if you go and tell them a problem, I have this problem where I can fix it. What? Because they know everyone in the town. They will tell you, go somebody near there, okay, in front of the mosque. There is a guy, he will fix it for you. Okay, he will fix it for you. Okay, so, okay, you go there, he will sort it out. Okay, this is how you do management as well. Go to the specialist, okay, they will do some tests and they will treat accordingly. Okay, this is tuk-tuk. You have not got marks for management for tuk-tuk. You need to tell, okay, what is this condition? How this is confirmed? When we confirm, how we treat? What is the treatment? How long is the treatment? What is the main medication? What are the other medication is given? Okay, you need to be very careful. You need to be, okay, for example, if you take a Parkinson's and Meniere's disease. Okay, the Parkinson, okay, it's an urgent referral. You don't start treatment anything. Once they will do MRI, they do the CT scan, they do neurological examination in the neurology department. Once this is confirmed, okay, then they will offer you treatment. Okay, the treatment is going to be replacing the substance, carbidopa or levodopa. Okay, so you need to tell that this condition is treated with this condition. Then, okay, so apart from that, the other things, okay, you will also be supported with multidisciplinary team, with safety netting, avoid driving. Okay, we will follow you up after the confirmation from the doctors. Leaflet. But if at the meantime, if you take a Meniere's disease, the Meniere's disease, when you suspect, you give medication. Okay, we will give you a medication. Okay, in order to control the symptom, the medication is called, what is the medication? Oh my God. Prochlorperazine. Okay, I'm sorry. So you need to know the name. Okay, you need to know the name of the medication. Prochlorperazine. Okay, so in order to control the symptoms, we will give you a medication called prochlorperazine. At the meantime, we also can give you another medication, okay, to prevent, episodes. So the medication will be started, by us now. Okay, yeah. So at the meantime, okay, it is a referral. It is an urgent referral. When you go there, okay, what will they do? How will they confirm? Okay, yeah. So the condition needs to be confirmed. Then you can talk about the rest of the things. So do you understand? So when it comes to medication, the name of the medication needs to come, and you need to also clearly tell when are we going to start the medication, what is the medication, how long is the medication, okay, is there any medication to prevent the acute attacks? So all this chunk of information need to be given. Okay, right. So when you give this, when you discuss the management, if you don't do like this, it's going to be tuk-tuk. Okay, for example, if you can diagnose someone with gonorrhea, okay, if you tell them we will refer to the clinic, they will test, okay, and they will give you some antibiotic. Okay, you will not get marks for this. You need to tell what sort of test they will do for gonorrhea. Okay, they will take a swab, they will do a blood, they will check not only gonorrhea, they will also check for some other sexually transmitted infections. If the gonorrhea is confirmed, gonorrhea is treated with an antibiotic called ceftriaxone. It is going to be an injection. It is a single dose, usually it is sufficient to treat the condition. Then your management should include during the treatment, avoid contacts. After completing the treatment period is considered to be a week. After the week, we will advise you to get tested. During the treatment, avoid sexual contacts. Okay, avoid sexual contacts. And okay, and in the future, practice safe sex. And at the meantime, okay, please advise your partners to get tested and treated. You see, this is management. Rather than telling, okay, they will do some tests and they will give you antibiotics, will not give you, okay, management marks. Okay, if it is everything is antibiotic, why they need to bring different, okay, STIs? Okay, why they need to give, the patient is allergic to? Okay, why need to bring a breastfeeding mother? You understand? No. Okay, this is all about management. So, okay, I hope clearly understand what is tuk-tuk. Tuk-tuk means, okay, it is basically, they will do some tests, they will treat accordingly. Okay, no, you cannot do tuk-tuk management. Okay, you have to give appropriate management with chunk of information. When it comes to management, you need to be very basic. Okay, you give us a chunk of information, ask the patient, do you understand? Is it clear? Okay, let me explain to you what else we need to do. Okay, what else we need to, okay, we need to do it here. Okay, let me explain to you. Okay, so, okay, do you understand? Is it clear so far? Do you have any questions at this point? So you need to check, but you need to be so busy. Okay, you need to give a chunk of information. Okay, that is management. You need to be so busy, right? So, okay, so make sure that you cover everything. Okay, that explain what sort of condition, checking understanding. So what needs to be, okay, done the next. Let me explain to you. Okay, what sort of tests need to be done, how we confirm, if it is confirmed, or if you go on the specialist, what sort of test will they do, how will they confirm, once it is confirmed, okay, how will we treat? Okay, this is the main treatment. How long, actually, usually how long is the treatment, whether it's treatable or it is just symptomatic treatment. Okay, there is something you need to talk about. Don't bring something negativity in the beginning. Okay, for example, if there is no treatment, like for example, Meniere's disease. Unfortunately, there is no treatment. So don't talk about that first. Okay, you need to tell the main treatment is controlling your symptoms. Okay, some people like to talk the negativity in the beginning. Okay, no. Okay, so make sure you have enough chunk of information. In the class, I will try to give enough chunk of information, whatever I do. Okay, let's see. The last bit in the management is answering questions. Answering questions also, it's important. Okay, answering questions. You need to know that what is management. Okay, management is diagnosis. Right diagnosis is a management. Explaining something to a patient is management. Now formulating a management plan. What is formulating a management plan? That means, that is be formulated. Okay, what sort of test we need to do, or where patient is going, how this is tested, how we confirm. If it is confirmed, how we treat, how long is the treatment, what are other things we need to be careful. This is formulating a management plan. Formulating a management plan is management. Okay. Managing patients' emotions is management. Okay, sometimes, okay, emotions comes. That is management. Okay, then doing the right thing at the right time is management. Your global performance is management. Answering patients' questions also management. Okay, answering patients' questions. That is also management. Okay, so everything is management. Okay, if everything is not good, Examiners, they don't want to pass you. They will put the hand in the management. They're so happy. You see, how the people have got four. Okay, they don't have anything against you. They just want to be a good doctor. Your communication is good. You have a sound medical knowledge. You are logical. You are a critical thinker. You have a very organized way of assessing a problem. They don't have anything against you. But the thing is, this is something you can achieve with your practice. Okay, you may not be able to practice all the scenarios. It's okay. Okay, get the gist of the scenarios, but they have a general nice approach. Okay, don't worry. Like I need to practice 400. I have only done 200. What I'm going to do 2 weeks? Okay, just simply know the structure, the story. Okay, I have a general structure. Okay, then you will be fine. Okay, you will be fine. Right. The last bit in the management is answering questions. Okay, when it comes to management, okay, when you talk in the management, always talk with we, not the I. Okay, the we will generalize your situation. Okay, another in the management you have a confusion. I'm an F2. Can I prescribe this antidepressant? Okay, can I prescribe this antidepressant? Can I prescribe this? Okay, no. You need to understand one thing. Okay, when it comes to okay, management, it is about who is going to do it. It is about how this is treated. Okay, how this is treated. It is not about who. Okay, it is not about who. Okay, how this condition is treated basically. Okay, when it comes to management, how this condition is treated. Okay, don't worry whether can I treat? I'm an only F2. No. The thing is, mainly our problem in the GP. The thing is, if a condition is treated in the GP, you can treat. And that is why that I have asked you to use the language we. We. Okay, we. Okay, we would like to refer, we would like to offer you some medication. Okay, so this condition needs medication. Okay, in order to treat this condition, we will advise you to take some medication. This is the medication. It is we. Okay, so when it comes to management discussion, always use we, not I. I will give you medication. Okay, I would like to refer you. No. The people who use we will be in a very good position than I. Okay, it is we. Okay, we would like to refer. The next important thing I wanted to tell you about seniors. Okay, because you wanted to call seniors. Okay, if you call seniors, you will have a problem. Okay, you will have a problem. Don't call seniors. It's another thing that is maybe new to you. Okay, because you have been everywhere seniors. If you keep on calling seniors, they will not like it. Okay, they will hate you. Don't call seniors everywhere. Okay, don't call seniors. I didn't say it, but I know why they don't like seniors. Because if you keep on calling seniors, they will think about your competencies. Okay, that will question your competency. See, the Plab scenarios is not for seniors. It is for you. It is for F2 seniors, F2 level. Okay, I didn't say it. Read the article. This article is written by Dr. Kurian. Dr. Kurian, okay. Dr. Kurian is an examiner. Okay, he has written this article for GMC. Okay, GMC is written. So what they have written is, the stations are designed to within the capacity of the doctor at the level of the beginning of the foundation year 2. And in the UK, and the examiners want to hear what your advice is. Okay, they want to know your advice, not the seniors. Okay, So there will be not any, under any circumstances, this will not be an appropriate response. Similarly, this is important for me. Be wary. Okay, be wary means that is how a polite man will tell you, don't call, don't do it. Be wary means don't. Be wary of telling the patient that you will discuss with a senior colleague. Okay, that means basically only you need to tell if it is necessary. He said you will not gain any marks if it is not an appropriate response. So they cannot tell you, they will tell you like we will reduce the marks. They cannot tell you, that is harsh. So they will tell you not gain marks. So it will be keep on zero. Okay, no, I don't want to tell you like this, but simply seniors, avoid seniors. Okay, they don't like this babysitting behavior. Okay, you don't need seniors to just to diagnose and treat polymyalgia rheumatica or diagnose and treat depression. Okay, don't keep on calling seniors. There are places you need to call seniors. For example, abuse-related scenarios, or a suicidal patient you wanted to discharge, or somebody is quite serious, like you have a meningitis patient, for example. Okay, meningitis patient, or somebody diagnosed with TB, you are suspecting TB. You can inform the seniors about it. You can tell, I will inform the seniors about it. Okay, there are places, but not for simple, obstructive sleep apnea or somebody having depression or schizophrenia. Okay, don't call seniors. I cannot tell you more than this. Okay, the good candidates, they don't need seniors. They want somebody to manage the business, okay, by themselves. Okay, people say, I have to be a safe doctor. Plab, okay, be safe. Somebody write article, okay, like on the Facebook, you need to be a safe doctor. What is safe? Keep on calling seniors is not safe too, because you are disturbing them. They have been treating somebody serious. You need to have a F2 competencies. Okay, so avoid calling seniors. I didn't tell this. The article says. Okay, avoid, not everywhere, seniors. Okay, it's not good. Okay, especially when the patient refuses treatment. When the patient refuses treatment, that battle is for you. Okay, that is for you. Okay, that is for you to battle. Okay, because patient didn't agree anything, I can bet you. Okay, calling the seniors will never make you to pass. Because I passed scenario, because I mentioned seniors. Okay, that would be the biggest joke in this year. Like I called the seniors, so they passed me. No. Okay, never. Okay, things like this going to happen. Okay, you don't need seniors. Avoid calling seniors. Okay, don't call seniors for simple things. Right, good. So that is one thing. So that comes with the we. Okay, the discussion of we. The thing is, it's we. We solve the problem. You work for a team. Whatever the team does, you do. Okay, is that clear? That has to be very clear to you. The next thing, when they ask question, it is the last bit of this. Okay, it's been too long, but I need to finish this. Okay, the last bit is this. Okay, whenever they ask questions, always start with well. When the patient asks question, you answer diplomatically. Okay, you need to have the defense. You need to have the idea of practicing defense medicine. So what is defense medicine? Defense medicine means basically you need to think that whatever you speak, can it cause any problem in the future? Okay, some people just overpromise. Okay, false reassurance. Okay, you cannot do things like that. Okay, no. So basically your answers are diplomatic answers. Diplomatic answers. So you start with well. Okay, well. If the patient asks you like, is it brain tumor? Well, okay. Whether will I be able to go to school next week? Well, start with well. The hidden meaning of well is, do you know the hidden meaning of well? Not really. Okay, yeah. But you don't say not really, you use well. Learn to answer like this well. That is a professional way. There's a way of doctors talking. Okay, the professional way of starting it to answer is well. You cannot abruptly answer. The second thing is how to say yes. Okay, people like to say, definitely, definitely. Okay, put your definitely in the bin. Okay, you like to say definitely, definitely, definitely. Okay, there's no definitely in Plato. If you have been doing definitely, they know that. Okay, you are not definite. Okay, avoid this definitely, definitely. Okay, we don't need definitely, definitely. Okay, it is okay. Don't use this definitely. Well, if it is yes, how to say yes? Okay, it shouldn't be a problem. Okay, that should be okay. You should be able to. That is the yes. Okay, how to say yes? You should be able to. For example, okay, if patient asks you like, will I be able to go on to school next week? You should be you should be able to go to work. Okay, yeah. Or it shouldn't be a problem. Will it cause any long-term complications? Well, okay. Well, okay. Okay, yeah. I mean, sorry. I mean, that is for no, no. So now, sorry. So now we have been talking about yes. Okay, yes. So yes means don't jump and say yes, yes, yes. Okay, don't jump and say no, no, no. The yes and no, they are 100% answers. We don't have 100% answers in Plato. We don't have it. Okay, we don't have it. Diplomatically, you cannot yes and no. Okay, well, how to say yes? Yes, how to say yes? Well, it shouldn't be a problem. It should be okay. Okay, it should be fine. Okay, if it is no, how to say? Highly unlikely. Well, it is highly unlikely. It is highly unlikely this can cause any long-term complications. Okay, is it brain tumor? You don't just jump and say, no, 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 it is not brain tumor. No, well, it doesn't seem like brain tumor. Well, it doesn't look like brain tumor. Always you need to leave a loop. Okay, technically you need to leave a loop in case anything goes wrong. Okay, you can escape from that. So how to say no? Okay, it is highly unlikely. It doesn't seem like. It doesn't look like. Okay, yeah, it is highly unlikely this can cause any long-term problem. It is highly unlikely. Okay. Yeah, yeah. Then, so if you don't know the answer, never use I don't know. Okay, never use I don't know. Instead, what do you use? Okay, I'm not really sure. Okay, never use I don't know even in your personal life. I don't know is a frustrating phrase. Okay, if you meet somebody and ask, is there any supermarket here? If the man on the street says, I don't know, that means he's yelling at you. Like, why are you asking me? A polite man will tell you, I'm not really sure. Okay, I'm not really sure doesn't mean they know little. Okay, some people more into it. Like, okay, so he's not really sure, but that means he knows something. No. Okay, I'm not really sure. Who missed the fracture? Well, we are not really sure yet. Okay, it's not very clear to us. Okay, so yeah, sometimes some answers you need to answer like it is difficult to say. Well, it is difficult to say. Okay, some answers like is he going to? Okay, when is he going to die? When is he going to die? Okay, that is it's basically it's difficult to say. But is he going to die? Okay, you need to say unfortunately he's not going to make it. Okay, that the message has to be clear. Okay, unfortunately, I'm afraid to say he's not going to make it. Okay, yeah, things like that. But when is he going to die? That okay, I'm afraid it's difficult. Doctors is difficult to say. But maybe it may be difficult to say exactly. So we'll talk about it a little bit later. But the four things is first thing how to say no. It is highly unlikely. It doesn't seem like. How to say yes? Okay, it shouldn't be a problem. that should be okay. Okay, it doesn't cause any long-term complications. Well, it doesn't cause, usually it doesn't cause. Then other answer is, the other one is basically, we are not really sure. Yeah, so some of them answers, okay, it's difficult to say. Well, it's difficult to say. So, okay, think about this. Okay, yeah, you need to you need to learn to talk for Plab. Okay, there is a doctors, there is a way of talking. Okay, you need to learn to talk. Okay, you need to understand the concept, learn to talk, then you are ready. But memorizing will not work. Okay, understand the concept. I'll try to put that sort of ideas. Okay, that's it, the basic thing. Okay, basic things, it's very important. If you understood so far what we have discussed, actually 50% of your problem will be solved. If you really implement this thing, okay, no questions now, guys. Okay, if you really implement these things, okay, then okay, you will have a big difference in the 50%. Okay, in terms of improvement. The implement among all this one, the important one I wanted you to implement is this one. Okay, this area, telling the diagram, not to summarize. Okay, that you have been telling that you are having some passing, some this and this, no need of this. Okay, you have been feeling dizzy and you also lost some hearing. No, thank you for giving this information. Do you understand what I mean by do not justify? It is a very big thing. You don't need to tell, you don't need to prove to the patient why this is Meniere's disease. You don't need to. What you need to do, rather, what is Meniere's disease? Okay, you don't need to justify, okay, because a wrong understanding, you need to take this from your brain. Okay, you don't need to try and tell everyone why this is Meniere's disease. No, you ask the appropriate questions to diagnose Meniere's disease. That's it, you are done. Okay, now your job is to explain rather what is Meniere's disease, what is depression, okay, what is Parkinson's. You don't need to justify why this is, okay, you have been telling that you have some tremor, okay, you're also having some difficulty in walking, no need of this. Thank you for giving this information. From the information I gathered, it seems like as your father had, you also may be having a Parkinson's disease. Did you know what Parkinson's disease is exactly? Because in Parkinson's, he knows this, his father had it. So you need to still ask, do you know exactly what is it about? Okay, do you know anything about it? No. Let me explain to you. Parkinson is a condition of the brain that affects the movements of the body, and that this is due to lack of a substance called dopamine in the brain. Okay, never tell chemicals. Okay, substance. Never use the word chemical. Chemical for layman is something not very pleasant. Okay, it's a substance. Okay, it's a substance called dopamine, like a lack of a substance. Okay, do you understand? Is it clear? Okay, now let me explain to you. Okay, what we need to do for you. Okay, what we need to do for you. First thing, when we suspect this, we refer to the specialist to confirm. Okay, so what is the specialist? When is he going? What will they do? How will they confirm? If it is confirmed, what is the treatment? What are the other things? What are the other professionals going to help him? Safety netting about driving, talking to the family. So this is how you enrich your management. You have to enrich your management. Okay, that is the crucial part. If you got that right, okay, if you work on that, okay, yeah, the style, let me explain to you. Okay, yeah, then it's sorted, actually sorted. Okay, yeah, because that is for history scenarios. Okay, other scenarios, okay, we have different approaches. But this is the first thing we need to sort. When you have this kind of understanding, the other things will improve. All right, so let me summarize, and in 2 minutes, and we'll take a tiny break. Okay, sorry about that. So first thing is, we need E, good command of English, emotions, that is two things, that is rapport and also empathy. You need to be energetic. In the exam sometime, this is India guidelines. Some examiners will come and vomit this in the beginning. Okay, they will come and tell you, we are looking for some energetic enthusiastic doctors. They will tell you. So they're looking for your energy. They are assessing your energy. You need to be a passionate and energetic doctor. They should have a belief in you. If they give you 48 hours shift, you will treat the first patient, the last patient with the same energy. Okay. Then the starting about, okay, it is the main thing. I am Dr. last name and are you. Okay, not you must be John. Okay, you must be John is okay, it is casual. Okay, you must be Harvey Specter. It is semi, okay, it's semi-casual. We don't need this, you must be. Okay, are you? Are you? Okay, then telephone approach, 5 steps. Okay, religiously you need to learn the acknowledgement, learn to acknowledge different situation. I talk about it. This is crucial part okay, when it comes to relative. Okay, how are you related to Mr. Muhammad Ali? I understand that you are somehow related to Mr. Muhammad Ali. How are you related to him? Okay, paraphrasing is you paraphrase if it is your plan, if it is a patient plan, whatever the background information they give, you need to ask the patient, how may I help you? I understand that you wanted to speak to one of the doctors. How may I help you today? In this one, don't change any color. Okay, don't put the orange in the red. Okay, don't put the blue in the orange. Okay, it will become purple. Okay, we don't need this. Okay, don't jump. Okay, finish department. Okay, yeah, we don't need this. Ice, I have told you. Okay, ice is an important thing. The main thing, okay, the explanation of the definition with where is the problem, what is happening there, and the risk factors. Checking understanding, crucial. Checking understanding is every scenario. That is interpersonal, that is management. Do you understand? Is it clear? Are you able to follow me so far? Okay, avoid the rubbish ones. Okay, then formulating a management plan. Okay, don't do tuk-tuk. Okay, I'll try to emphasize throughout this class. Okay, okay, that's it. That is the first part of it. The next thing, we are going to start with some scenarios. Okay, before that, I will give you some break. The first thing, okay, scenarios related to emotions. Okay, in terms of that, I'm going to start with some breaking bad news scenarios. Breaking bad news scenario yesterday, the people have, till last night, I've sent you the scenarios for you to read the background just to know it a little bit rather than everything new. Okay, the first thing that we are going to talk about breaking bad news. In terms of breaking bad news is the starting point. Okay, in terms of Plab to communication. Okay, if somebody is good, the first thing, if you are not good, this is my understanding. If you are not good in breaking bad news, you are not going to good in anything. Okay, yeah. Okay, it is not like if you are good in breaking bad news, you will be good in everything. No, other way around. If you are not good in breaking bad news, you are not going to be good in anything. Okay, and breaking bad news is the starting point of our communication. Okay, scenarios. So we have around 8 scenarios we need to discuss. Okay, we will discuss all of them. Okay, before that, we will take a tiny 10 minutes break. I'm sorry I pulled you this much. Okay, we started a little bit late because of the registration. We'll take a 10 minutes break. Okay, grab your coffee. We'll have a lunch break around 2:30. Okay, 2:30 UK time, 2:30 ish. Okay, whatever happens, okay, around 2:30 to 1 hour. So we'll have grab a coffee and we'll come back. Okay, we'll come back in 10 minutes.